All right, good afternoon, everyone, and welcome to this subcommittee of the Senate Committee on Health and Human Services. I am Senator Angie Taylor. I have the honor of running this meeting, and we will start with our roll. Madam Secretary?
Senator Lang, Senator Stone, Vice Chair Taylor, Senator Titus, Chair Doniate.
Thank you so much. As you may be aware, the other members of our committee are still in committee, but we know that many of you are waiting, and we know these are available online. So we're going to go ahead and get started. We cannot take a vote, so we will not start with the hearing. We will not start with the work session, but we will start with a hearing. But before we do, let's just tell you a little bit about what our day is going to look like. We will start, as I said, with Senate bills, with hearing Senate bills. Today, we're going to hear Senate Bill 118, 127, 300, 372, and 389. Those are the bills that we will hear, and then we will work session Senate Bill 8, 24, 84, 137, 182, 183, 188, 234, 250, 257, 284, 299, 330, and 390. And we will get started after I give you just a little bit of housekeeping. So welcome to everyone in Carson City, anyone who may be in Las Vegas or online. We will have one public comment opportunity that will be at the end of our meeting. So if you'd like to make public comment in person here in Carson City or in Las Vegas, or you can do that by phoning in, you'll have 2 minutes for your public comment. The call-in number is 888-475-4499. The meeting ID is 896-946-50328. As we have our hearing, I want to say this up front for everyone that we will have 15, 15, 15 for support, opposition, and neutral testimony, because as you know, we have a full agenda. I want to remind everyone to please turn off your electronic devices, if you will. When you come forward to testify, please make sure you turn on your microphone, speak loudly and clearly, and state your name for the record. And the first time you state your name, please spell your last name so we can get the minutes, have them correctly. If you plan to testify, please make sure you've signed in over at the door. In fact, you can sign in even if you don't plan to testify. And if you have a business card, make sure you share that with our committee staff. And then finally, you'll see the subcommittee. We have our laptops open, and Robin doesn't, but Senator Titus doesn't, but I do. You'll see committee members and subcommittee members as we come in with laptops in front of other electronic devices. Please do not take that as a sign of disrespect or inattention, but we have exhibits and notes and so on that we often refer to during this time. I have a note here from our chair, and the intention is to start with Senate Bill 389. Senate Bill 389. So we will open the hearing for Senate Bill 389. This Senate bill revises provisions relating to the administration of pharmacy benefits under Medicaid and certain other health plans. And before us is Senator Melanie Scheibel. Please, Senator, go ahead when you're ready.
Thank you so much, Vice Chair Taylor, Senator Titus. My name is Melanie Scheibel. I am the State Senator for District 9. Happy to be in front of you today presenting SB 389. SB 389 is the PBM bill you've all been waiting for. This bill, in short, will require the state Medicaid plan to switch to a single PBM, a single pharmacy benefit manager. I will not waste time explaining to all of you what a pharmacy benefit manager is, because I imagine you are familiar with them at this point in time. And so other, quick highlights of the bill include, as I said, requiring Medicaid to move to a single pharmacy benefit manager. It would prohibit the use of spread pricing by that pharmacy benefit manager, and it would save the state lots of money in the long term. It complies completely with federal law. There is an amendment posted on Nellis. It is largely what I would describe as technical, and it would still allow Medicaid to have the multiple MCOs, the management organizations, the managed care organizations, but they would all have to utilize one single PBM. I also did bring along a friend from the State Office of Health Policy and Financing to help me answer any questions, which I would be happy to do at this time.
Thank you so much, Senator. Senator Titus, I see you're reaching in, so I know
yeah,
you have a question. Why don't you get us started?
Thank you, and thank you for being here and patience of waiting, as you are well seasoned in this time of year and how this process works. So it's good that we're moving forward and presenting it. So thank you for bringing the bill. I don't think there's anybody in this room that doesn't recognize that we needed a change how the PBMs operate, at least to the point where we can save some money for our Nevada state citizens. Question, who will pick the one pharmacy benefit manager? There's going to be one. Currently there's 5, right? Or I think there's 5. So how will that be decided?
Melanie Scheibel, for the record, thank you for that question. I'm scanning to find the section of the bill, but it would be from the Department of Health and Human Services, the Office of Health, Finance, and Policy. They would do basically an RFP. They would accept proposals from existing pharmacy benefit managers and then make a choice from there.
Okay. All right. Thank you for that. I'm good.
Oh, and I think I found it in section 12. They'll evaluate the applications and then enter into a contract. Section 12 on page 15.
Section 12.
That one's a long section.
It starts towards the top of page 15.
Okay, got it. Thank you.
Absolutely.
And then the amendment that you have, because I'm madly looking for that, it's on Nellis. You said, what does it effectively do? Is it semantics?
Melanie Scheibel, for the record. Yes, it adds some language, specifically in section 5, to refer back to federal statute and ensuring that we continue to comply with federal regulations and requirements.
Thank you so much, and thank you, Senator. Thank you for bringing this bill. As my colleague said, our colleague said, this is something we really would be great to get our arms around. Just a question for you: other states, are there other states more likely to have one PBM or many, such as Nevada?
Melanie Scheibel, for the record. Other states do have single PBMs. There are actually a few states that run essentially their own PBM. So instead of contracting with the pharmacy benefit manager, somebody within their, the equivalent of their DHHS would handle, or a team within their state department would handle that process. And there are definitely also still states that are in the same position as Nevada, dealing with multiple PBMs on their state Medicaid plans.
Thank you, Senator. I would imagine that there's great savings that can be realized.
Melanie Scheibel, for the record, yes, absolutely. It will save the state money. It will save patients money. It will save our constituents money. Moving to a single pharmacy benefit manager has not only the savings in the monetary cost, but also it relieves some of the pressure on our healthcare workers, especially pharmacists, who are trying to navigate. I mean, I know I don't want to belabor the point because I know you've already heard all of this, but it must just be incredibly frustrating as a pharmacist to be trying to fill, 3 of the same prescription, and for one patient it's going to be $4.50, and for another patient it's going to be $6.50, and for another patient it's going to be $7, and they all might be on Medicaid, and that's got to be, incredibly difficult to manage, and so this will clear up that kind of stress, that kind of lack of clarity, and also help ensure that we're getting that $4.50 price instead of the $6.50 or the $7, because we then have that bargaining power as a state.
Thank you, Senator. I think that's all the questions that we have now. So unless you have more, we will open it up. And just in time, our pharmacist walks in. Come on up, Senator.
And I did find the amendment. So.
Okay, good. And so what we will do is we'll open it up for any testimony in support of Senate Bill 389. If you'd like to testify in support here in Carson City, please come forward. If you are in Las Vegas and you would like to testify in support, please go ahead and come up as well. And then certainly we'll get to the phone line. Again, 15 minutes for support and for opposition and for neutral. And you may go ahead when you're ready.
Thank you, Vice Chair and members of the committee. For the record, KB Mejia, Keibimejia. I'm the policy analyst at the Ferrado Company here today on behalf of the Nevada Society for Dermatology and Dermatologic Surgery in support of SB 389. This bill increases transparency and savings in Medicaid, and we urge your support. Thank you.
Thank you so much. Please, sir, go right ahead.
Good afternoon. For the record, my name is Adam Porath, Adamporath, and I'm representing the Nevada Society of Health System Pharmacists. We represent the pharmacists and pharmacy technicians working in hospitals and health systems around our state. Here in support of SB 389. I like that one too. But as was mentioned by the senator, it is very frustrating as a practicing pharmacist to have multiple PBMs for Medicaid patients. When patients move from fee-for-service Medicaid, there might be something that is on the formulary that is then not on the formulary when they go to an MCO plan. So this would definitely streamline things for patients. It would help to have a singular prior authorization process across the state. As well as the states that have done this, there's been demonstrated savings. So, thank you.
Thank you so much, Mr. Porath. Anyone else here in Carson City? Okay, seeing none, we will go to Las Vegas. Is there anyone in the room in Las Vegas to testify in support of Senate Bill 389? I can't see the room in Las Vegas. Do we know? Do we have them? Okay, while we do that, we'll go ahead and go to the phone lines. We can go to the phone lines. AVH, do we have a caller online to testify in support of Senate Bill 389?
If you'd like to testify in support on Senate Bill 389, please press star 9 on your phone to take your place in the queue.
Am I talking now?
Caller, you are unmuted and you may begin.
Hi, my name is Nancy Cadigan, NancyCaddigan. I am a pharmacist. I work for the Washoe Tribal Health Center, and I am also part of the Nevada Pharmacy Alliance, and I write in support of 389 for all the reasons that people have already said. Thank you very much.
Thank you so much. We'll go to the next caller.
Hello, my name is Evan Williams, and I'm speaking on behalf of the Nevada Pharmacy Alliance. We represent pharmacists, patients, pharmacy technicians, and pharmacies throughout the state. We are in strong support of SB 389. We do believe that this will reduce prescription drug costs because the state will be able to negotiate as one large PBM and get better pricing, and it enhances the state's control over the Medicaid spending. This also protects our rural and independent pharmacies from PBMs imposing unfair reimbursement rates, and it improves access to medication as well. To a previous point that was brought up, I do want to let you guys know that Ohio and Kentucky have passed similar legislation. In Ohio, the first year that they implemented this change, they had $186 million of savings, and in the second year, $230 million of savings. And in Kentucky, they did this, and they had $283 million in savings, with 56.5 of that coming directly from state funds. So we believe that this is good for the state, it's good for the pharmacists, it's good for our patients. And so the Nevada Pharmacy Alliance is in strong support of SB 389. Thank you.
Thank you so much for calling. We'll go to our next caller.
Caller with the last three digits, 309, please press *6 to unmute yourself. Once again, caller with the last three digits, 309, please press *6 to unmute yourself. Vice Chair, I'm so sorry. Caller, you are unmuted.
Hi, good afternoon. Hi, good afternoon. My name is Amanda Villa. I am a pharmacist practicing in Henderson, Nevada. I do strongly support SB 389 due to previous reasons that others have stated. So I am in strong support of SB 389. Thank you.
Thank you so much, Ms. Villa. Is there another caller?
Hello, all. My name is Amy Hale, Amyhale, and I am a pharmacist in Southern Nevada. And I really don't have much to add to what's already been said, but I think this will be a very positive change for patients and providers and pharmacists. So I would like to express my strong support of this bill. Thank you.
Thank you so much for calling. Is there anyone else, AVH?
Yes, Chair, we have one more caller.
Hi, my name is Lisa Hamill. I am a pharmacist with Swiss Pharmacy in Las Vegas, Nevada, and I wanted to express my support for this bill as well.
Thank you for calling, Ms. Hemlock. Okay, that's it for support testimony. And now we will start 15 minutes of opposition testimony. We'll start here in Carson City. Then we'll go to Las Vegas if we're reconnected to Las Vegas. And then we'll go to the phone line. So we'll open the hearing up for opposition to Senate Bill 389. Anyone here in Carson City? Okay, seeing none. Why don't we go to the phone lines? AVH, do we have any opposition callers?
If you'd like to testify in opposition, please press *9 on your phone to take your place in the queue. There are no callers in opposition at this time.
They're checking. Thank you so much, AVH. And now we'll go to neutral testimony. If we have anyone who would like to testify neutral here in Carson City, please come forward. At this time, no neutral. How about on the phone lines, AVH?
If you'd like to testify in neutral on Senate Bill 389, please press *9 on your phone to take your place in the queue.
Good afternoon, Madam Vice Chair and members of the committee, Liz McMenamin. I'm sorry, I was trying to get in to testify in support of SB 389. As many of you
Caller, let me just interrupt you for a moment. Would you mind giving us your name again and please spell your last name? We missed it.
Oh, I'm so sorry. Liz McMenamin, MacMenamin, with the Retail Association in Nevada, representing community pharmacies. And I'm just going to say, and if you wouldn't mind, Vice Chair, making sure that my testimony is in support for SB 389, and I will keep it brief, and thank you for your indulgence.
Thank you so much, Ms. McMinion, and we do have you down as support testimony. Do we have another caller, AVH?
Chair, there are no more callers at this time.
Thank you so much. We would like to make sure that we haven't missed anyone in Las Vegas, so we're going to take a quick recess until we can verify that we're not missing any feedback, and then we will close the hearing after we've given those folks in Vegas, if there's anyone there, an opportunity. So quick recess, and then we'll be back. All right. Welcome back, everybody. Thank you so much for your patience. Vegas went completely down, and now we're back up. So we will give them an opportunity to give testimony on Senate Bill 389. So if you are in Las Vegas and you would like to testify in support of Senate Bill 289, please come forward at this time. 389, that was it? Yes. Okay, no, I don't see anyone coming forward. Oh, wait, here's somebody that's going somewhere else. Okay. Or if you're okay. If you're in Las Vegas and you would like to testify in opposition to Senate Bill 389, please come forward at this time. Thank you. All right, seeing none. And how about any neutral testimony for Senate Bill 389? Okay, well, thank you, Las Vegas. We're glad to have you back, and we wanted to make sure you didn't miss out. So we will close our presenter, Senator Scheibel, had to get to a committee meeting, so she had no closing comments. So we will close the hearing on Senate Bill 389. And now we will go to our next bill. Our next bill that we will cover, that we will have a hearing on, is Senate Bill 300. Our presenter, Senator Dondero Loop, is coming forward. So we will officially open the hearing on Senate Bill 300. Senator and presenters, please begin when you are ready. And just as a reminder, 15 minutes of opposition, 15 minutes of support, and 15 minutes of neutral throughout our meeting on today. Please, Senator, go right ahead.
Thank you very much, Vice Chair Taylor. And I'm going to talk really fast so we don't lose our connection. My name is Marilyn Dondero Loop, and I represent Senate District 8 in Clark County, and I'm honored to present SB 300, which makes revisions relating to Medicaid. Currently, the Department of Health and Human Services provides that Medicaid will provide coverage of services provided by a psychiatrist, psychologist, advanced practice registered nurse, marriage and family therapist, or licensed clinical social worker at a federally qualified health center. In 2023, this federal statute was expanded to authorize federal financial participation for Medicaid coverage of services provided by mental health counselors, including alcohol and drug counselors, problem gambling counselors who hold a master's degree or higher, along with the professional counselors who provide services at the federally qualified health centers. This bill aims to codify the existing federal requirement that Medicaid covers services performed by the listed professionals as it was amended in 2023. It also requires the director of DHHS to apply for any waiver of federal law that is necessary to carry out the provisions of the bill. There is an amendment before you that is a friendly amendment, and I'm recommending, after consulting with Stacey Weeks and her team at DHHS, to correct a drafting issue. USC 42, which defines mental health professionals at the federal level, does not include clinical LADCs nor LADCs. To guarantee we can maximize the number of master's level behavioral health professionals, we decided it was best to add these three professions to the currently approved list of providers in Nevada rather than using the generic term of mental health professional. With me today is Helen Foley, the board chair of First Med Health and Wellness, and Helen is a prominent FQHC, that is a prominent FQHC in Southern Nevada, although our sweet Helen is also very prominent as she was a former legislator. So Helen will introduce members of the First Med leadership team and more information about the need for this legislation. And if I can, Madam Vice Chair, I'd like to turn it over to her.
Please go right ahead. We will make time for the famous,
and she
would you call her?
The very important,
yes,
by the way, former legislator Helen Foley.
Thank you, Ms. Foley. Please go right ahead.
Thank you so much, Madam Chair. Helen Foley, HelenFoley, and I am the board chair for First Med. We appreciate so much Senator Dondero Loop introducing this legislation for us. First Med has been around for about 10 years, and every FQHC has primary care, the medical care, and then they get to select one additional discipline. Most of them select dental. First Med has mental health services, behavioral health services as their secondary discipline. And we've been going like gangbusters for so many years now. It's really wonderful. I'm very proud that First Med has been designated by HRSA with the gold standard, meaning they are in the top 10% of all FQHCs in the nation. While we have a robust list of mental health providers that we can draw from and receive Medicaid reimbursement, we were missing out on the opportunity to use professional counselors as well as the alcohol and drug abuse counselors. And so that was the need for the legislation. With me today is Angela Quinn, who is the CEO of First Med, and I would like for her to explain a little bit about what our specialties are and the people that we serve. In addition to that, but for brevity, we will not have them speak. I did want to introduce you to Lenitra Grady, who is our Chief Medical Officer, and Maisha Wilson, who is our Chief Operating Officer, who is responsible for all the mental health services. And they are here. Wave to us, ladies. So thank you very much, and we're here for any questions afterwards. But I'd like for Angela Quinn to continue.
Thank you. Thank you, Senators. Angela Quinn, ANGELA-QUINN. I'm the CEO of First Med Health and Wellness. Annually, First Med has about 40,000 individual encounters. That is with about 10,000 patients. 60% of those require mental health services. We have 27 licensed therapists. We have 2 psychiatrists. One of our psychiatrists is board certified in adolescence. We have 3 locations across the valley, and we'll be opening a 4th location in May on the Child Haven campus. We were awarded the contract to provide services at Child Haven in July, and we've just seen an exponential growth in the needs for kids in foster care, both at Child Haven and then when they leave into a foster family or reunited. Substance abuse is a profound challenge, as I'm sure you all are aware of, and while MFTs and LCSWs do great work, that extra education that an LSDC has is different, and it's important to the way we do business. CPCs, while it's a lower level of care, it is able to fill gaps. A lot of our CPCs are interested in growing their careers in play therapy and dealing with very young children. But currently, for First Med to have either of those disciplines provide service, we don't get reimbursed. So we'd like to come up with a method that would allow us to take our 27 therapists and make it 47 therapists, get rid of our wait lists, and thank you to Senator Dondero Loop for supporting this, and I'm here to answer any questions that you may have.
Okay, thank you so much to the 3 of you and the 2 of you for being here. We will open it up for any questions from the committee at this time. Please go ahead. Senator Titus?
Thank you, Senator, for bringing this forward. I think access to care, as you know, is important to me, but it's been important to you too. So these are really important, especially mental health aspect. I just have a clarification question, actually. So frequently in our rural areas, and you have rural areas, I know, in Clark County, and rural hospitals there, you have federal FQHCs, but we also have critical access hospitals, and we have rural health clinics. Would this impact their ability to have these services? Frequently in legislation, we'll see both mentioned at the same time in a bill, and this just mentions the FQHCs.
Thank you, Senator. Helen Foley, for the record. I spoke with, upon your insistence, I did speak with Blaine Osborne about this, and he said he was supportive of this and did not feel that it needed an amendment, that we should start out with the FQs, and possibly when they need these services that they would come back.
So very well known and famous Helen Foley, I would say. No, I always appreciate your advocacy, and thank you for taking a suggestion and knowing the question that I was going to ask, and that's part of what makes you very well known and famous, and you do a great job. Thank you.
I'm all puffed up. Thank you, Senator.
Any other questions? I think we're okay. Senator and Ms. Quinn and the very famous Ms. Foley, if you wouldn't mind stepping back, and we will now open the hearing for any testimony in support of Senate Bill 300. And remember, again, 15 minutes, 15 minutes, 15 minutes. If you're here in Carson City and would like to testify in support, please come forward at this time. If you're in Las Vegas and would like to testify in support, please come forward as well. Go right ahead when you're ready.
Thank you, Madam Vice Chair and members of the committee. I am the infamous spouse of the formerly famous Senator and Assemblyman Ernie Adler. So my name is Sarah Adler, A-D-L-E-R, and I today represent Vitality Unlimited, who is a provider of residential substance use disorder treatment, and the Nevada Opioid Treatment Association. So both of these clients, as well as myself, are really excited about the amendment to Section 1B that was just described to expand FQHC's ability to employ licensed alcohol and drug counselors and licensed clinical alcohol and drug counselors. That's the LCADC. And those individuals are completely exciting because they have advanced training in both substance use disorder and in mental health. As you're aware, a lot of people who suffer from an addiction are in fact medicating what might be an underlying mental illness. So to be able to provide both of these services where they receive their frontline health care is going to be fantastic. Stigma against seeking treatment for mental illness and substance use disorder has been lessening over the last few years, and that's very positive. But if you can get this care where you get your primary care, you really have the opportunity to treat any piece of your disorder. So we think this is a great bill and are in strong support and appreciate the sponsor. Thank you.
Thank you, Ms. Adler. Seeing no one else come forward in Carson City or in Las Vegas, AVH will go to the phone lines for support testimony for Senate Bill 300.
If you'd like to testify in support on SB 300, please press star 9 on your phone to take your place in the queue.
Thank you, Vice Chair Taylor and members of the committee. My name is Steve Messenger, that's Messinger, for the Nevada Primary Care Association. We represent the state's federally qualified health centers like First Med. Our members are required to locate in underserved areas, and 88% of health center patients have incomes below 200% of the federal poverty level. We would like to thank the bill sponsors for this proposal because when you target services in an FQHC, you are helping Nevada's most vulnerable communities. 30% of our patients are uninsured and almost 40% are covered by Medicaid with few options for high quality integrated care. That's when your primary care is with your behavioral health care, as First Med described. You know, I was just doing the math and our behavioral health care visits have increased 58% just from 2018 to 23. And that's after topping out in 2020. So this is an important segment of our population. It's an important service that we're offering to our communities. And for this reason, we thank the sponsor and support SB 300. Thank you.
Thank you, Mr. Messenger. Is there another caller?
Vice Chair, there are no more callers in support at this time.
Thank you so much. Now we'll open the hearing for testimony in opposition to Senate Bill 300 here in Carson City or in Las Vegas. Seeing no one come forward, AVH, is there someone on the phone line in opposition?
If you'd like to testify in opposition, please press star 9 on your phone to take your place in the queue. Vice Chair, there are no callers in opposition at this time.
Thank you so much. And now we'll open the hearing for neutral testimony. Anyone neutral here in Carson City or in Las Vegas, please come forward. And seeing no one, then we'll go to the phone lines. AVH?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Vice Chair, there are no callers in neutral at this time.
Thank you so much. Senator Dondero Loop, if you'd like to have some closing comments.
Thank you very much, Vice Chair and members of the committee. As I mentioned, this is already on the federal level, so this bill would simply codify these provisions in Nevada law. And I want to thank the very famous Helen Foley. And because I don't ever miss a chance to talk about Nevada history with my friend the senator there, my father taught the famous Helen Foley's father in high school. And I'm sure our fathers would be very proud of us doing these types of bills for Nevada. Thank you very much.
Thank you so much, and thank you again, Senator, for bringing this bill. Okay, we'll close the hearing on Senate Bill 300 and go to our next bill, Senate Bill 127. Our presenter is here, Senator Buck, and I think you have others with you. Please come forward. Senate Bill 127 revises provisions relating to certain training for first responders. Senator, when you're ready, please go right ahead.
Good afternoon, Vice Chair Taylor and members of the Health and Human Services Senate Committee. My name is Carrie Buck, and I'm lucky to represent Senate District 5 in wonderful Henderson, Nevada. Vice Chair, I want to thank you so much for this gracious opportunity to present Senate Bill 127 to the committee today. A little over 2 years ago, before the Super Bowl in Las Vegas, I was asked to do a public service announcement for Prevent Child Sex Trafficking, and it ended up joining their coalition to end sex trafficking of children. Having my eyes open to the reality of traffickers selling and abusing our most vulnerable, precious children for money and personal gain, I was horrified this was happening within our communities. On November 26, 8 missing children were rescued in Las Vegas. And again, on February 19th, 7 children were recovered in Las Vegas, the youngest being 11 years old. On April 4th in Reno, 9 victims were recovered. These were recovered in the news, and this was in the news in the last 6 months alone. But how many more victims are out there? Human trafficking impacts our most vulnerable population and continues to grow, to be a growing concern in our state. In fact, Nevada ranks #1 in the nation for human trafficking incidents per capita by World Population Review. And when trafficking occurs, women are the ones who suffer the most. The National Human Trafficking Hotline reported that about 90% of human trafficking victims in our state are women, and 21% of all victims are children forced into the sex trade. After seeing the stats and the cases, we cannot stand idle. We cannot unsee this evil, and we cannot unhear the heartbreaking stories of these victims, how their souls were stripped of innocence in such a heinous way for the sake of raw, selfish greed for money. It is simply imperative that we work together to protect children from predatory abuse and to do our best to support those who have tragically already been victimized. SB 127 ensures that our first line of defense, our first responders, are prepared and equipped to properly respond to situations involving victims and suspects, giving them the necessary knowledge and skills to keep them safe and help support the victims in their care. Now, for a quick summary of the bill before I pass to my wonderful co-presenters, SB 127 requires licensure of certification of emergency medics, firefighters, paramedics, 911 dispatchers, and ambulance professionals to include an hour of human trafficking awareness training. Additionally, this bill prescribes the requirements relating to such training, including, but not limited to, identifying and interacting with victims of human trafficking in a manner that ensures the safety of the victim and the licensee. Lastly, with the amendment, this bill requires training to be completed on a biennial basis instead of on an annual basis. Now I'd like to turn it over to Tina DeCola.
Thank you, Senator Buck, and thank you, Vice Chair Taylor. My name is Tina DeCola. I am recently retired from Las Vegas Fire and Rescue. I was a 911 dispatch professional for 22 years. I now am an instructor for a not-for-profit that instructs 911 professionals throughout the country. 9 years ago, I took a 911 call from a victim that was brought to Las Vegas to be trafficked. She had escaped her buyers and was hiding behind a dumpster somewhere in Las Vegas and had no idea where she was. In all my years on this earth and in all my years of being behind, wearing a headset, I've never heard anyone so frightened. And I honestly was not prepared. There was no protocols in place. There was really no training in place. Along with my partners over at Las Vegas Metro, we were able to find her after 20 minutes. At that time, we didn't have the technology to find her from her cell phone. So we were able to find her. And doing some research, I found that there was no training for 911 operators, and there was very minimal training for our fire and EMS partners. So at that time, our deputy chief put me on the task force. I've been on the Southern Nevada Human Trafficking Task Force for the past 9 years, and I created training for Southern Nevada. This training includes our private ambulance partners, since we are on the same computer system. It includes all emergency operators, fire, and EMS. The reason why it is important that they're trained is statistically, victims may call and ask for an ambulance before asking for a police officer. And if the private ambulance folks or the our EMS partners are not prepared, they may miss clues or they may miss an opportunity to get the help that a victim so desperately deserves. So the training does include, as Senator Buck stated, it's a human trafficking 101. It basically goes over what different things to look for, different ways to approach the victim, using a trauma-informed approach, also using different codes versus saying things like human trafficking over the radio. Just a little background again, the radio traffic for fire, EMS, and ambulances are not encrypted. So anyone can listen. So we don't want to highlight attention to the scene. So we created a protocol that keeps everybody safe. Our victims, our nurses in the emergency room, and our first responders out in the field. And the training's been very, very successful. We've had multiple successful recoveries in Clark County, North Las Vegas, Henderson, and with the private ambulance folks as well. I also put together a few exhibits. The first one that you'll see is a roadmap. And the roadmap basically on the top, 17 highways that all interconnect throughout the United States. And you can see that most roads lead to Nevada. So that's why, because we're such a major hub in Nevada, all of our partners need to be trained. And we all need to be trained the same, because standardized, mandated training is successful. It's not just successful for the patient or the victim, but it protects and prepares us as first responders also. Okay, so at this time, I would like to introduce Annika Huff in Las Vegas. She is a survivor of human trafficking, a leader, and an expert of living this experience.
Good afternoon, Senators. Thank you for having me here today. I'm here to share my personal experience I had with fire during my trafficking experience. I was born in Denver, Colorado. I grew up in a home like many children. I had abuse, neglect, and a lack of resources. And I was moved to Clark County to live with my father when I was a teenager. When I met my trafficker, I was within 24 hours trafficked by him. My trafficking experience was short, but it was extremely violent. I did have interactions with law enforcement. I was trafficked in a public space on the Las Vegas Strip, but I had one interaction with fire during my trafficking experience as well. In the month of June, my trafficker had forgot to pay the electric bill, and he was using his car to run an air conditioning unit in the bedroom that him and the other girl I was trafficked with was able to use in the room they were in. This instance, law enforcement would have never been present to the scene. In this instance, I was at this point staying in a separate room. I was sitting on the floor. I was about 105 pounds at the time. I was severely beaten and was not allowed to stay on furniture from septic. I was having infection in the body. When this fireman had walked past the doorway of the room that I was sitting in. When he walked past, because of the fact that my trafficker was startled by them even coming to the scene in the first place, the door was not closed. He was able to interact with me just by looking at me. And I could tell from that very brief look that he was concerned. And for the first time in my trafficking experience, someone was concerned about my well-being. And I remember at that point, I had moved from the corner of the floor that I was on, and I moved a little bit closer to the door in hopes that that fireman would come into the room and have a conversation with me. Unfortunately, my trafficker saw that I had this look, and he had closed the door behind us, behind me seeing him. And he didn't come back, and that fireman did not come back into the room. When they left, I had continued to be trafficked and was able to escape my trafficking because I was 3 hours from death. And I was hospitalized for a month and had decided to, moving forward 2 years later, testify through the court system against my own trafficker, where he was sentenced to life in prison without the possibility of parole. Because of a law that you guys put into effect in Nevada in 2013, I was able to put him away for life. From that experience, I have started to work on anti-trafficking for about 9 years now. I've worked throughout the country and want Las Vegas to continue to become a safe place for my survivor brothers and sisters. And my interactions I've had with first responders and people who had those initial interactions in my trafficking experience are so crucial. Those are the people that actually could be trained into recognizing what human trafficking looks like, but also be trained in how to respond and interact with us, and stop the cycle of abuse that continues to happen for so many people who have experienced something like I did. So I thank you for your time. I would like to bring it back to Tina, and she will be introducing our next speaker.
Tina DeCola for the record. Thank you, Annika. Thank you, Madam Vice Chair. I would like to now introduce a 25-year fire captain for the Las Vegas Valley, Michael Suska.
Thank you very much. For the record, my name is Michael Suska, S-U-S-C-A. I'm one of the receiving trainees from the optional training that we received. So I've been in the fire service about 30 years, 25 years within the Vegas Valley. About 7 years ago, I was serving in the training division. Our EMS division was offering optional training for human trafficking. And at the time, I'd heard about it. I knew it was bad, didn't know much about it, especially for all the years in the fire service. I received the retraining, and it was horrific. Modern day slavery, and it landed with me. And it probably landed with me because I have a 5-year-old daughter at home at the time. Like every class, I tried to be a good student and take notes, and that's what I did. I took notes and put it on my phone. Whenever I returned to the floor, I would have those resources with me anytime. If it's not our department policy, we have it on our computer in our fire engine. So I returned to the floor probably about a year later after that training and serving in the training division, back to my busy company that I've been busy throughout my whole career and put myself in busy stations for the experience and to provide the best I could possibly be for the community. And I expected to maybe run across a situation in my career. I didn't come across one. I didn't come across two. I came across three in the field, and then a fourth in my personal life. And I'm here to say, without that training, I probably wouldn't have caught it. Now, we see things, we get a lot of training, but the training that we received pinpoints these situations and separates it. And it was astonishing to me. When I started talking to the other members of my crew, law enforcement, just give them a heads up on those cases that I came across, they were surprised when I showed them and told them some of the signs and tells, they were like, oh, okay. And they proceeded forward and we followed up. Without that training, I probably would have missed it. It saddens me, I'm happy that I was able to detect the cases, but it definitely saddens me of all the years, 17 prior, that I might have missed. And that's what hurts now to this day. To this point, it's optional, right? And that day that I took the training, it was optional. I happened to be in the training place division, happened to be the right place at the right time. Not all of our members got to get the training. We get a lot of training in public service, and when it comes to optional or mandatory, there is a difference. And I fully believe this needs to be mandatory. We can't let one of these cases happen for the horrific tragedy that they experience. When you hear victims say, I'd rather be dead, and when you hear the stories, I think if we save one case, it's worth the mandatory training. Thank you very much for your time.
And thank you, Vice Chair. We're open for questions.
Thank you very much, Senator Buck, and all the presenters, and certainly Annika in Las Vegas. Thank you for sharing your story. That couldn't be easy to do, but we really appreciate it. We'll start with Senator Titus for questions.
First, I want to thank Senator Buck for bringing this excellent bill forward, and all of your co-presenters for not only sharing your stories, but also for sharing solutions, because that's really what this is about, not just standing by. And you were proactive in sharing solutions, so thank you. And again, thank you, Senator Buck. I do have some questions. You have an amendment that's in the bill itself. It talks about doing a 1 hour awareness training online, and it must be done annually on multiple areas. Is the amendment now saying it's biannual? Just for clarification, get that on the record, because I don't have a copy of the amendment.
Yes, the amendment was submitted. Clark County Fire suggested biannually, so every other year.
Okay, and so that's the only change in the current writing. It would just be biannual.
Yes.
Okay, thank you for that. And then is there a charge for that? Are these all, follow-up question if I might, Madam Vice Chair, sorry. Is there a charge for this training? So if we mandate this training, is it all free? Can they access it, available online? Will there be a charge, a fee?
Tina DeCola for the record. Thank you, Senator Titus, for the question. No, there is not a charge. At all fire agencies and with our private ambulances, we all have training platforms. So what I did was I created a training for them to upload, and they're able to watch it. I've also trained their training officers, like a train the trainer, so they're able to not only do the biannual training, which is standard for us, that's why we changed it, we do every other year. We're able to do the training in our academies, so they're getting it from the academies, and then they're getting like a refresher every other year. That way they get updated stats, or they get things that have changed, of course, because as things change, or things are, especially with the traffickers, we want to make sure that we're kind of staying ahead of them, and they're trying to stay ahead of us. We want to make sure that everybody's on the same page and getting the fresh training.
So, Ms. DeCola, were you the one that created the training, or was it training in other EMS departments or other states?
There was no training for dispatchers, and there was very minimal training for fire and EMS. So along with Las Vegas Metropolitan Vice, I also consulted with two other task force, one in Minnesota, one in Baltimore. I created the training, and we made it an SOP, a standard operating procedure, and that everyone can use. And then, like I said, the training, I'm doing a training for the emergency room nurses, and there's no charge.
This is more of a comment. I'm very impressed by your activity. I have to say, we have had handouts and presentations in this body that had copyrights on them, and we couldn't share and we couldn't upload, to my frustration, and people brought that up. And there you are creating programs and sharing it nationwide with everybody who needs help. So kudos to you, and thank you for that. And thank you, Madam Chair, for the question, Vice Chair, for the questions.
Thank you so much, Senator Titus. Any other questions? I don't have questions, but again, just want to commend you for your work, and thank you for bringing this bill. This really important group. So why don't we open it up for testimony and support? Thanks to all of the presenters. Senator Buck, if you wouldn't, Ms. Dakota, would you mind stepping back? And then we'll open it up for people to testify in support. Okay, just as a reminder, 15, 15, 15. So now we're opening up the hearing for anyone who would like to testify in support of this Senate bill. Any support testimony come forward at this time? Senate Bill 127 here in Carson City. If there's anyone in Las Vegas who would like to, thank you to our presenters in Las Vegas. If yes, make room for those who may want to testify in support. If you're there, I see some people in Vegas, please come forward. At this time, you'll have 2 minutes, and we'll get started. Please start when you're ready. State your name and spell your last name for the record. Okay.
Good evening, Senators. My name is Ariel Van Cleve, and my last name is 2 words, first being V-A-N, second C-L-E-V-E. I am a 23-year-old student at the University of Nevada, Reno, majoring in journalism. Today I'm here to urge your support for SB 127. Nevada ranks among the worst when it comes to human trafficking, and this situation demands a response. Since evidence has suggested a high demand in the world of sex trafficking for young women, minors and women around my age arguably face the greatest threat of exploitation. When first responders are trained to effectively identify and report human trafficking situations, young women everywhere in our state are made safer, and victims are given an avenue of escape. Thus, the mandated training proposed by SB 127 is clearly a step in the right direction, and the bill itself comes with no fiscal note. This measure is a smart, budget-conscious policy for Nevada, which certainly deserves bipartisan support. So, for the sake of Nevada's young women and minors, please advance SB 127 for a vote. Thank you.
Thank you, Ms. Van Cleve. Please, sir, go right ahead.
Lieutenant Colonel Retired Will Bradley, B-R-A-D-L-E-Y, for the record, of Las Vegas. And I'm a lobbyist for United Veterans Legislative Council. In my case, went to war 4 times for this country, but also for law and order. So what's the purpose of a free country if we don't have law and order and people are getting trafficked and kidnapped within our borders? So that's why this has gotten the attention of veterans like me to rise in support of this bill. And one thing I've noticed from research is that airlines, which are not mandated that they go through this training, are going through this training. And some airlines, next time you fly to Vegas, you may look in the lavatory. I noticed on Southwest, they have placards in the lavatory saying if you are being trafficked, let the flight attendant know or call this number. And they're not mandated to doing it. They're doing it because it's the right thing. Now, when you're dealing with state and local agencies, I can understand the need to mandate, and I agree with that. The only thing I'd ask you to be careful of is the second and third order effect is what happens when somebody falsely accuses somebody of being a trafficker. I'd urge you to look at putting some protections in there because we'd rather people turn people in and be wrong than never turn people in, and they should have. So I'd ask you to look at that so people aren't hesitant to report. So with that, I think this is very important, and it's a travesty that in the United States of America this is still happening. And before you can spot something, before you can spot a crime, training is necessary. So I am in support of this. Thank you.
Thank you so much, Colonel Bradley, and we thank you for your service as well. Anyone else here in Carson City? Seeing no one, I do see some folks in Las Vegas. We'll go to Las Vegas now for support testimony for Senate Bill 127. Just remember to state your name and spell your last name for the record, and whomever would like to go first, please do.
Good afternoon, Vice Chair Taylor and members of the committee. My name is Annette Dawson Owens, ANNETTEDAWSONOWENS, with the Children's Advocacy Alliance, an independent voice for Nevada's children with the mission to ensure that every child thrives. I'm here today as an advocate for children and for the victims of human trafficking. We are speaking in support of Senate Bill 127 because it addresses a critical gap in how we protect children in crisis. Right now, first responders, dispatchers, and those who often arrive first on the scene in an emergency are not trained to recognize the signs of child trafficking. This means many children who are being exploited remain invisible, even when help is right in front of them. Traffickers know how to capitalize on this. They often avoid law enforcement and instead turn to EMTs or paramedics, first responders who, without training, may not know what they're seeing. SB 127 ensures our professionals are equipped to identify red flags, ask the right questions, and take action when a child's life may be in danger. There is no fiscal cost to this bill, and in places where it's already been implemented, first responders have reported rescuing children from trafficking situations they wouldn't have recognized before. Let's implement giving them the tools necessary to protect our most vulnerable and not miss a chance to save a child's life. Thank you for your time and for your commitment to standing up for the children in Nevada.
Thank you, Ms. Dawson Owens. Please go right ahead when you're ready.
Good afternoon, Madam Vice Chair and members of the committee. My name is Renee Ruiz, RENEE-RUIZ. I'm with National Nurses United, National Nurses Organizing Committee, and we represent the interest of more than 3,000 nurses across the state of Nevada. Many of those nurses are emergency room nurses and are the first line of defense when someone enters for an emergency situation. We wholeheartedly support this bill. It would be a shame for us not to do anything or everything that we could in order to make sure that not one person is in a trauma situation or stuck in a trafficking situation where we could actually help them get out. Thank you. We appreciate it.
Thank you so much for your comments. Seeing no one else coming forward in Las Vegas, AVH will go to the phone line for a support testimony.
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue.
Good afternoon, Senators. My name is Rachel McCord, MCCORD. Thank you to Senator Buck, Tina, and all of those sharing your heartfelt stories today. And thank you to the committee for hearing this. I am calling in to express my strong support of SB 127. As an adult survivor of childhood sexual assault, I can tell you firsthand that the trauma and shame that I felt caused me to avoid reporting my experiences for quite some time. When I did report the abuse with law enforcement from 2 different states, I can tell you that the massive difference between the empathetic response I received from one versus a more typical emotionless response from the next had a great impact on me. In fact, I was too triggered to proceed, and as a result, I wasn't able to continue, and my abuser is still free today to potentially abuse others. When you've been abused, you look to people of authority with a sense of fear. So finding your voice can feel quite impossible. This bill is so important because while the drug trafficking industry, which receives a significant amount of public attention, is worth $34 billion worldwide, the human trafficking industry is close behind with $32 billion a year. It is time we fight back. We have got to protect our children, our community, and our world. So I would urge this committee with high hopes to not only all support this bill, to provide mandatory training to help our everyday heroes do an even better job to protect and serve. But there's no cost for this. So the cost of not doing this is far greater than any of us can comprehend. I not only ask you to support the bill, but I also humbly ask you to move to immediate work session. Thank you all for your time.
Thank you so much. Next caller. We have 8 minutes left on the 15 minutes for support. Please go ahead.
Hi, my name is Joel Kisner, Kisner. I'm representing this for my own company as an unpaid lobbyist with Pinnacle Consulting and Advisors. I have some other human trafficking work I'm doing up in the legislature, but when I saw this come up to a hearing, I wanted to lend my voice. I'm retired law enforcement. I left Metro in 2017. And just to give you some scope, I dealt with crimes against people since 98 forward in investigative roles, a graveyard, do sexual crime, assault and abuse, and also working for 5 years with OJJDP and the Department of Justice, where I did investigate crimes involving children with facilitation of technology and internet, and I taught for that as well. Throughout my years and ending in homicide, I saw human trafficking cases more than I would care to remember. There were 4 that actually ring out in my head as I'm going forward, and I was shocked at the number of barriers I had just trying to get assistance to get some of the resources and some of the assistance I need from the investigative point of view. And over the years, I've been tracking this problem, and I have a consulting business now where I'm doing work that touches into the human trafficking space. And I realize that things are getting better, but there's still more work to be done. And the unique thing about this bill, and to kind of parrot the rest of the supporters, especially the colonel that did speak, it's about expanding the coverage of the folks that can flag things up that need attention, whether it be for law enforcement purposes, whether it be for medical attention, whether it be for additional support, mental health counseling. All those things can be triggered if somebody does the right thing. And in order to do the right thing, we need to expand out this training and make sure that the people that are seeing these victims have the tools and know what to do with the information in a timely manner.
Mr. Kisner,
So I just wanted
Mr.
to let
Kisner,
you know
thank you so much. I'm sorry, your time is up, sir, and we want to get to as many people as we can. We appreciate your call.
Absolutely. Thank you much.
Thank you. Next caller, please.
I'm Rhonda Shortino, spelled RHONDA SCIORTINO. I'm a resident of Las Vegas and co-founder of Prevent Child Trafficking Nevada. Thank you so much for hearing SB 127. Prevent Child Trafficking Nevada is strongly in support of this bill because people travel from all over the world to buy and sell children in Nevada. This is the worst form of child abuse, which is for the entertainment and profit of others. The heinous crime of commercial sexual exploitation of children is brutal. It has been estimated that children trafficked have a life expectancy of 7 years. When a child is injured, traffickers who count on the profit from selling that child may call fire and rescue, probably never going to call the police. Can you imagine being a paramedic rushing into a hotel room to treat an injured child to realize that you're in the room with an armed and dangerous trafficker? You're unarmed, you're unable to make an arrest, you've had no specific training on how to respond to the situation. Now the child and the medic are in danger. We must pass Senate Bill 127 because it mandates the training of first responders who currently have no specific training on identifying and safely protecting children and themselves from traffickers. First responders are in support of this bill. You've heard how many other people are in support of this bill. Those who have completed the training have reported having identified and rescued children, and we strongly urge you to please move SB 127 to an immediate work session. Thank you so much again for hearing.
Thank you so much for the call. And I'll encourage callers to be as concise as you can so we can get as many in as we can with the time we have remaining. We have 5 minutes left. Next caller.
Hi, my name is Ralph Krause. I'm an educator here in Nevada. I'm calling in support of SB 127. You can spell my name RALPHKRAUSS. I'm calling in support of SB 127 to combat human trafficking in our great state. We really want to be known as a national leader in something so tragic. I have hope that our elected officials will choose to do what's right and take meaningful action to protect those who can't protect themselves. I'll end my statement with this, the Gandhi quote: "The true measure of any society can be found in how it treats its most vulnerable members." Thank you very much for your time.
Thank you so much, Mr. Krause. Next caller, please.
Hello, my name is Ashley Rybar, R-Y-B as in boy, A-R, and I'm calling in to express my strong support of SB 127. I'm a community member, a mother, and have been working with child sex trafficking. And basically everything that you've heard here, it saves the children's lives that are being trafficked. And when they have no voice, it really helps these EMTs and responders to help their subtle ways that the children can't have voices to save them. So I just urge you and ask the committee to move this to immediate work session.
Thank you so much. Next caller.
Good afternoon, Vice Chair Taylor and members of the committee. My name is Lauren Boytel, Lauren Boitel, and I'm here on behalf of the Nevada Policy Council on Human Trafficking in strong support of Senate Bill 127. We recognize that our first responders undergo extensive and often demanding training. Their responsibilities are broad, and the scope of their knowledge must cover a wider range of emergency situations. We also understand that countless social issues call for their attention and compassion. However, what makes SB 127 so essential is the special and critical nexus between human trafficking and first responders. These individuals are often among the very few people who may encounter a trafficking victim during a moment of vulnerability, on the street, in a home, or responding to a medical crisis, when the victim might otherwise go unseen and unheard. This is a unique and powerful intervention point. First responders are not there to arrest or interrogate, they are there to help. Their role is inherently one of care and trust, and for trafficking victims, many of whom are conditioned to fear law enforcement or may be in the presence of their trafficker, this difference can mean everything. A trained EMT or firefighter who knows how to recognize subtle signs of trafficking and how to respond in a trauma-informed and victim-centered manner may be the only safe person a victim encounters for weeks or months. That one encounter, if handled well, can be the turning point that leads to safety and support. We must continue building a system that is robust, trauma-informed, and responsive to the complex needs of victims. And so we thank Senator Buck for her sponsorship of this important bill, Tina DeCola for her leadership and advocacy, and we urge the committee's full support of SB 127. Thank you.
Thank you so much. Next caller.
Hi, thank you, Madam Vice Chair and Senate, to let me speak. This is Annie Lobert, A-N-N-I-E, for the record, L-O-B-E-R-T. I am the CEO and founder of Pink Chair, a chair conversation and change for women that are in trafficking, young ladies that are in trafficking. I've been working in the community for 21 years. I am a survivor myself. This bill, I am in full support, and I will get a little emotional right now because I was in a situation where somehow the ambulance got called, the police got called as I was trying to escape my trafficker. I had a broom in my hand for self-defense. I went running out of the driveway. My finger was completely ripped open because he locked me in a door, and I busted it open with the top of the toilet seat, and the porcelain thing shattered on my hand. He had been choking me. The whole back bottom of my body was black and blue, and my ribs were kicked in. And when the EMS got there, they immediately sat me in the ambulance, but then the police informed them of my record of prostitution of 24 arrests. And as soon as the EMS attendant heard my record, they tied me into the gurney and they laid me down and told me to be quiet. I was in my pajamas, and the police officer said she is going to jail for domestic violence. Meanwhile, my trafficker's laughing in the background, saying, "Oh, she's going to hit me with that broom." I got rushed to the hospital. They left me in a dark room. For hours, I was crying out, "Help, help, I have to go to the bathroom. I'm in such pain." I was throwing up on myself. I peed my pants. And then I got brought to the police station, and they searched me, and they treated me like a criminal because of my record. Now, had the EMS known by what the police officer probably had to tell him by law that I was a victim of trafficking, I believe this not would have happened to me. And I stuck in that jail for another, I believe it was 12, 24 hours. I finally got let out. I had to do domestic violence anger management classes. Every time I walked in that room to go to those classes, my head was in shame because I knew I was not guilty.
Miss Lobert, I am so
Yes.
sorry to interrupt, but your time is up, ma'am. So if you have other comments, please send an email to our
I'm in
committee
support of this
staff.
bill.
Okay, thank you.
Thank.
Okay, that was actually a minute or so over, but that's our last, the end of our 15 minutes for support testimony. And now we will go into opposition. Any opposition for Senate Bill 127 here in Carson City or in Las Vegas? Okay, seeing none, we will go to the phone lines, AVH.
If you'd like to testify in opposition, please press star 9 on your phone to take your place in the queue. Vice Chair, there are no callers in opposition at this time.
Thank you so much, and thank you, Vice Chair Taylor, for helping me today. Now we are moving on to neutral testimony. Is there anyone in neutral on the bill? Please come forward. I don't see anyone here. AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. I do have a few questions. I know I came late to the bill hearing, so maybe if I can invite the presenters to come forward, because I think there's a few issues that I just want to make sure I get clarified. So, thank you. And first and foremost, thank you so much for the advocacy on the bill and bringing this. I have more questions on the technicality, and so I just want to go through them. The first section of the bill that deals with the training concerning identifying and interacting with persons that have been victims of human trafficking, etc. Who is going to be doing this training, and what is the certification process to ensure that these entities are communicating evidence-based trainings versus just someone just standing up a random organization? And I apologize if my questions have already been asked. So,
Thank you for the question, Senator Chair Donate. I'm sorry, Tina DeCola for the record. The training that was put together has been approved by Las Vegas Metro. They also do trainings through the task force because we wanted to make sure that the training that fire is getting mirrors what law enforcement's doing. So and their approval, I got their stamp of approval before it went out because, again, we don't want, like you said, someone going out and doing certain training and then it doesn't match up with what law enforcement's doing. So the training that was put together that we currently have in Southern Nevada, what I did was I trained the trainer for, like, the training officers at Clark County Fire, Las Vegas Fire, Community Ambulance, etc. And then every year with statistics from Metro or different changes, because things change all the time, we then just send out the new training that can be uploaded, or we can do it in person.
So just to clarify, so it is the responsibility of essentially the department to manage the training and to develop the training. Is that correct? Is that my understanding? No?
Tina DeCola for the record. No, sir. The training's already been developed. The only thing that
by who?
By me. and by the Southern Nevada Human Trafficking Task Force.
Got it. And is there anything that has certified that this is a evidence-based training and that there's research behind what you're training to the officers?
The training's actually going, Tina DeCola for the record, the training's actually going to, not to law enforcement, but it's going to fire and EMS. And the evidence that we're presenting is based upon all of the interaction that Las Vegas Vice has had and all of their evidence-based interaction, and that's the same training that they give their officers.
Thank you. But I just want to clarify, that's not what I'm asking. I'm asking the trainings that you are facilitating to EMS and police, right? When I refer to evidence-based, right, these are programs that have been researched by either universities or institutions to qualify the curriculums that you're developing towards implementation. I'm not saying that the data that you're showing the police officers has evidence to it. I'm asking, what is a certification that the training that you're providing is accurate, and what are the entities that are going to be administering it? Is it one entity that's going to be doing it for the whole state? Like, what are the qualifications that what you're delivering is correct and that is actually helping the law enforcement officers understand what the appropriate response would be to the community?
Tina DeCola for the record, I'm sorry. Thank you for the clarification. The only certification that we've really gone through is through the professors over at UNLV, because they have the statistics basically for the state. And other than that, the only like I said, the only other certification has been through Las Vegas Metropolitan Police Department.
Great, thank you. The next thing that I had was, I believe it's in the same section. It's the renewal of a license must complete the training required by the subparagraph. I believe from my understanding, there was an amendment, this was before I got here, that would say that you're switching it to biannual. Is that correct?
Carrie Buck for the record. Yes, that was submitted with the help of Clark County Fire Department.
Thank you. And perhaps maybe Leo can answer this question for me, but it is my understanding that there are portions of the bill that deal with when you get your actual certificate before you're starting to practice, so to say. But I believe this is the first. So if I'm looking at other sections of the bill, I'm looking at page 4, section 2, right? And then it goes on to page 5, where there's trainings already in terms of active terrorism, biological agents, chemical agents, and so forth. But it's my understanding that this is not a continuing education requirement. So this would, by tagging it to the renewal of the license, right? This is the first time that we're putting in state statute continuing education requirements. So I just want to make sure that we're on the same page, that your goal is not to just train the new ones that are coming, it's to require them to keep coming every 2 years for the same training. Is that correct?
Tina DeCola for the record, yes, that's correct.
And is there, I think that the difficulty that I find with that is, I think that oftentimes with any trainings that we require for our officers, right, there's a question of if we're training them on the same thing that is repetitive, right, are there new structures that are going to be implemented from year to year versus having our officers, because we have shortages, helping with crime, right? So I guess there's a question that at what point does it become too much? Is it easier to just focus when they're being trained to go out into the field at the first time, or is your intention to go for the continuing education? So I just want to make sure that that was clear.
Tina DeCola for the record, thank you for the question. Just to go back a little bit, because since you weren't here, just to kind of go back how it works with how we are trained. We are initially trained in our academies for things such as CPR and different things like that. Every 2 years, we have to be recertified. We have to have those trainings again. And that was the reason why we had added it biannually, because things do change. We want to make sure that, again, they're not getting death by PowerPoint and they're not seeing the same thing over and over every 2 years, that they're getting updated training, because because things do change. I did a training for Henderson Fire, for example, 4 years ago. I just redid their training this past few months, and it's different because, again, we don't want to just make it boring and repetitive. We want to make it effective. So that's why we want to make it every other year and have those additions at.
Thank you. And then just the last thing that I just apologize because I wasn't here for the presentation. Can you reference where this is already being implemented, where similar training is already in effect? I'm assuming you're saying that it's done through Southern Nevada, that this is already a part of the curriculum for the academy, right, that the officers have to go through?
It's Tina DeCola for the record. It is mandatory for law enforcement, but it is not part of the regular, consistent curriculum for fire or EMS or dispatchers.
And just want to make sure, so you're referring to law enforcement in Southern Nevada. Do we know of any other state entities that are not implementing this as part of their training?
I don't, Tina DeCola for the record. The last I read, California has implemented something similar a few years back for EMS, but other than that, I'm not certain. I'm not sure of any other states that are implementing it for.
Sorry, I just want to. I'm referencing in Nevada. Is this a standard practice already implemented across all the officer trainings, or is this only being done in Southern Nevada?
Tina DeCola for the record, to my knowledge, it's only being done with Las Vegas Metro. I'm not certain of the other agencies.
Great. Thank you so much. I don't know if there's any other questions from any of the committee members. Senator Titus.
Thank you, Mr. Chair. Just for clarification, I think along the same line of what you were trying to kind of sieve out on the training and just clarify on the training. The program, you developed this program because there was a need. You did it through research and what your experience, and you've been doing it for how many years now through your agency?
Tina DeCola for the record, 9 years.
9 years. Are there any other, Nevada absolutely is the number one in human trafficking, and Las Vegas, just by sheer population, is kind of that, but it happens throughout our state. There's a sheer huge number in Las Vegas, so you saw that need. Other states, though, it does happen in other states. Do you know if there's other states that have programs and educational programs for dispatch, EMS, any of those things?
Tina DeCola for the record. Thank you for the question. The only state I'm aware of is California, and it's not mandated for their dispatchers. It's only mandated for their incoming EMS professionals and not the folks that are already established.
It shut off. I was worried that we were going to go down here. And just for clarification, this is part of a training process that, say, a dispatcher learns how to handle certain calls, what they're doing, if it's emergency, what the questions are, and so part of a training program for fire and police, they learn about. We've mandated some things like mental health training and some of this. So this is the training. They're not getting credits, continuing education credits. That's not what this is about. This is part of the training to be a dispatcher, training to be a part of fireman training. Is that correct?
Tina DeCola for the record, that's correct. The paramedics do need continuing education credits, and those can be offered, but it's mostly for the certification of their position.
That's right. So that this individual hour to hour training that you do is not for certification per se or credits. It's part of a training process they go for to renew their license, to get their initial training post-academy, and all of those. That the officers are already doing that at their post-academies, correct?
Correct.
All right. Thank you. Thank you, Mr. Chair, for the questions.
Thank you, Senator Stone.
Thank you. Just want to verify that, again, this is an online course. It's an hour course, and it's free, correct? So we're not like we're pulling officers off the street to do this, or dispatchers off the street, or firefighters or ambulance drivers. It's a very convenient way to get educated biannually, right?
Tina DeCola for the record, that's correct. We have training platforms that we're able to do that without causing overtime or without pulling folks out of the field or off the phones.
Any other questions? Just one last one. I saw that the implementation is July 1st, 2025. Is that enough time to implement it? Have you talked to any of the agencies in terms of feedback for that?
Tina DeCola for the record. Since we all basically use the same training platform, it's called Target Solutions. It's very easy just to upload it. So that seems like a very feasible timeline.
Great. Sorry, I just want to make, I cut that at the end. My question was not referencing if the training is ready. I'm saying, are the jurisdictions, the counties, et cetera, are they prepared to roll out the program? Have you had any discussions with them about it?
Tina DeCola for the record. The agencies that I've had conversations with in Southern Nevada, Clark County Fire, Las Vegas Fire, Community Ambulance, AMR, and Medic West, they are ready and prepared to go July of this year.
Got it. I don't know if there's anyone in the audience that represents any of the counties or anyone from Las Vegas Metro Police Department. I just want to confirm that that's accurate.
Can I add on a question, if I may?
Please go ahead.
Senator, for the record, Michael Suska, SUSCA. I think you missed my presentation or my story beforehand, but just talk about the training aspect of it. For Henderson Fire, Tina has provided training for us, and we have it uploaded in our system. And also, too, just to also stress the fact of I know you missed my story, but I was one of the receiving trainees about 7 years ago, and followed up 3 cases of it because of the training. Fortunately, I did have that training because there was other officers and other personnel on scene that did not catch it. So just to stress the fact of every layer of that can be encountered for anybody that's being trafficked is super important to follow up, have initial training in the academy, and I recommend it because we always have a lot of training. But this is a critical one, and so I'm all for the recertification of it as well. Thank you very much.
Chair and members of the committee, Josh Martinez, Las Vegas Metro. I'll have to get with the Senator Buck, and talk with the presenter and get a little bit more details on this, so I could reach out to our folks over at Communication and get some details on that, and I'll get back to you, the committee. Thank you.
Thank you. I don't know if there's anyone else represented from the counties that would like to come forward. I just want to double check that this is... Oh.
Chair John Steinbeck, for the record, just recently retired as Fire Chief of Clark County. Just wanted to confirm that this is part of our biennial training, already loaded up into the system and would be implemented without issue. Already confirmed that with the current fire chief as well.
Thank you. I think I was more questioning of the ones that haven't implemented such similar training. So I don't know if that has been answered yet. So
thank you, sir.
Yeah. I don't know if there's anyone else.
Ryan Beeman, for the record, representing the Professional Firefighters Nevada. As you've kind of already heard, we do a lot of this training already throughout the state. It didn't come up because we recognized this years ago, 5 years ago. We started to implement this. We actually have protocols in place to help with our members and what type of radio communication that we when we recognize these type of situations. Most of our departments throughout in Southern Nevada do use a Target Solutions type program that is implemented. In Northern Nevada, I can tell you, just looking at the physical note like Reno, there would be a cost to it. I think there was a cost in Clark County when they put their physical note also to it, because we would have to, we have to put units out of service for that type of training when we do any of this mandatory type training. So, and we... a lot of this is, like I said, we support the training, and we've already implemented it down in Clark County. Thank you.
Thank you so much. Anyone else? All right. I think we concluded our questions. I appreciate for the indulgence of letting us ask our questions. And so if you want to go ahead and take a step back, I'll go ahead and close this hearing. And now we will move on to our next one, and we will do Senator Steinbeck's Senate Bill 372. So if you want to come forward. I'm going to go ahead and open the hearing for this bill. This bill revises provisions relating to the care of children, so please begin when you're ready.
Good afternoon, Chair Donate and members of the Senate Committee on Health and Human Services. For the record, my name is John Steinbeck, and I proudly represent Senate District 18 in Clark County. I appreciate the opportunity to present Senate Bill 372 today, which aims to assist parents and guardians of children with behavioral health issues and is inspired by Arizona's Jacob's Law. This legislation provides a much-needed framework for supporting families navigating complex behavioral health challenges while safeguarding the welfare of children. I just want to state that I'm joined here to my right by Kim Surratt, and she is an attorney specializing in adoption law. Also in Southern Nevada, I have a constituent that brought me this issue, and her name is Kim Alexander, and she's also joining us. Just a little bit of background, and we will be concise because we know you've been here a long time today. It can be very challenging for some of these families, the significant issues of children that suffer from mental and behavioral health disorders and navigating through the system. Parents, legal guardians, foster parents may become overwhelmed with children whom they love very much but have high behavioral health needs, and they pose a risk to the family's safety and welfare. In those situations, they need professional help to protect the children with the behavioral health needs and their own family members. We need to make sure they can access that help for the well-being of the children. Existing Nevada law defines abuse or neglect of a child and outlines circumstances under which a child is considered harmed or threatened. However, the law does not explicitly address situations where parents seek mental health care for their children or bring children with significant behavioral health needs into their homes. These gaps can lead to unintended consequences, such as parents being accused of neglect when they attempt to admit their child to a mental health facility, or adoptive parents facing scrutiny for taking in children with behavioral health challenges. Senate Bill 372 builds upon these existing statutes by expanding protections for parents and guardians, providing that their efforts to address behavioral health risks are recognized and responsible caregiving rather than neglect. And now I'd like to turn it over to Kim Surratt, so as she is an expert in this field and faces represents families that face this every day.
Thank you. Thank you, Chair Donati. Kim Surratt for the record, S-U-R-R-A-T-T. I've been a family law attorney for 23 years at this point. I have been lobbying in this building for 22 of those years unpaid. So as I continue to be here, I continue to have more stories, and they grow, unfortunately. This is a issue that has slowly grown on my plate. I'm going to tell you a few of my background elements. Please know I'm not speaking on behalf of any of the organizations that I'm going to tell you my history on, but I am on the Board of Trustees for the Academy of Adoption and Assisted Reproduction Attorneys, which is an international organization of adoption attorneys. I am an appeal hearing officer for Washoe County Human Services Agency, and I have been doing that since 2007. I have had the unfortunate qualification of starting to become an expert in these cases. I say unfortunate because they are heartbreaking and sad stories. What is going on is that we are getting members of our community to adopt children with very special needs and a lot of mental health conditions and concerns. And these children are turning in a lot of ways, they're very dangerous a lot of times. And the parents are very desperate, and they're seeking treatment for these children. And it's a very vicious cycle of trying to get them treatment, trying to get facilities to take these children at times. They go into treatment. The facilities sometimes decide that the child is too much for them to handle or too dangerous for them to keep, and they won't keep them in treatment. Sometimes courts are ordering these children to treatment, and we can't keep them in treatment. These families find themselves in predicaments where if they take the child home, the child may be a danger to other children in their home or to themselves. Or if they don't take the child home, it's found to be abuse and neglect in of itself. We also have abuse and neglect provisions for subjecting the child or subjecting children to domestic violence or threats of danger. So the children in the home, it's neglect to have them at home, neglect of the other children. It's neglect to not take them home from these treatment facilities when they need additional treatment. It's a vicious cycle. I have a long list of horrible stories, unfortunately. The two major sections of this bill have to do with just not finding abuse or neglect in the sole element of seeking treatment, or that if you do take them home and they pose a safety risk and you're trying to do the best for this child and be the interim home before you can get them additional treatment, that alone is not neglect also. As a hearing officer, the standard for finding abuse or neglect or substantiating it is what we call it. Substantiating abuse or neglect is a reasonable person standard. Is there sufficient evidence that a reasonable person would find it to be abuse or neglect? Unfortunately, these families fall through the cracks where people get a very different interpretation of the frustration that the parents are going through and trying to get them help. And sometimes it starts to appear to social workers that these parents don't love these children. How dare they not take this child home, or that they continue to seek treatment, and that they are, quite honestly, viciously trying to seek treatment for the child because it is what's in the child's best interest. A lot of confusion happens from that, and it grows over time. But I've had some of these children in these circumstances where the parents, the child has been bearing butcher knives in the backyard, has a homicide list, and the parents are in the step siblings, etc., are on that list. I have had children who have been a runaway risk, and I have had parents say to social services, this child will run away if I take this child home. Social services says, you have to take this child home. They take the child home, the child runs away. The child goes to Kids Cottage, runs away, ends up trafficked. I mean, it's a vicious ongoing cycle. The point of bringing that up is this bill is just a minor fix in two different ways to just say, don't use this as the grounds for finding abuse and neglect. But I can tell you, we have a lot more work to do than what's in this bill. This is just a tiny little fix for one small element of it. And there are a lot of entities in the room who I have had conversations with, and the senator has had conversations with, that in the interim, we have a lot of work to do on this. We really need to be wrapping these children in additional services and the families in additional services. This is just a very minor fix towards that effort. Because unfortunately, the repercussion of doing this to families is that family law attorneys start to recommend against adoption. We start to say it's too dangerous to take children with special needs because as soon as you take it off of the county's hands or the state's hands, that child becomes a risk to you, that you are put in a position of abuse or neglect when you try to seek this treatment, or they're dangerous and the others in the home are at risk. I'm here for any questions that you have.
Thank you, Kim. John Steinbeck again for the record. I'd like to now, Chair, if it's okay with you, turn it over to Kim and Rain Nadtar in Southern Nevada. And I've asked them just to kind of give you a little bit of their background in 3 or 4 minutes. So Thank you, sir.
Is it okay that we go now?
Please, Kim, please proceed.
All right. Thank you, Senator. Thank you, Attorney Surratt, and thank you all for listening to us today. I'm Kimberly Alexander. This is my husband, Rain Alexander. This is regarding an urgent need for legal protection for parents seeking mental health treatment for severely mentally ill children. We want to bring to your attention a deeply distressing and unjust situation that my husband and I currently face and many other families across our state faced when trying to protect our children, ourselves, and our community. Our child has been suffering from severe mental health challenges, including homicidal ideation towards family members, which has posed a serious threat to the safety of our household, including multiple physical altercations with family members, which included weapons, destroyed property, and many elopements. After exhausting every available outpatient and community-based options, including years of therapy sessions and medications, we made the heart-wrenching but necessary decision to seek inpatient psychiatric treatment to protect our child and family. While in treatment facilities, peers and staff members have been assaulted by our son, property destroyed in excess of thousands of dollars, which they have billed us for. The assaults led to either arrest, elopements, or forced discharge. 150 treatment facilities across the country and in Nevada have denied treatment due to the violence. CPS forced us to take him home or be charged with neglect and abandonment after one facility discharged him after assaulting the third staff member there, and after being a runaway for more than 14 hours. He then eloped 2 weeks later from our home after CPS brought him back to our home. He was arrested 4 days later for assaulting a woman and attempting to steal a vehicle. He was placed in another facility and assaulted peers, the next one a staff member, and then was arrested for kicking a staff member in the face and pulling her dreadlocks out. The current facility he is in was court-ordered by the judge. In his 11 weeks there, he assaulted 2 staff members and showed aggressive behavior towards teachers. Probation called CPS to open a case a few weeks ago prior to a discharge date, charging us with abandonment and neglect. He has not been discharged yet, stating we refuse to take him home. We did not say we refused to take him home. We said we were not equipped to take him home upon discharge after just assaulting 2 staff members and not wanting to bring a child who has been violent for years and has medical documentation of homicidal ideation towards us. Should not be neglect and abandonment when we fear for our lives and fear what he will do in the community. Even at a so-called lockdown facility, he still managed to assault 2 staff members. This is not a safe discharge when he has high risk of elopement and repeated violence. Rather than receiving support, we have been subjected to multiple allegations of child neglect and abandonment, even while participating in family therapy, weekly calls and treatment team calls, and simply for attempting to secure life-saving care that we as parents are not equipped to provide alone without mental health professionals. We respectfully ask you to consider the following. Seeking and providing mental health treatment is not neglect. Parents should never be punished for trying to get professional help when their child poses a risk to themselves and others. Our legal system and child protective services must distinguish between true abandonment and parents' responsible efforts to obtain emergency mental health services. Mental health care access is already in crisis. Parents should not face added trauma of child welfare investigations or custody loss when making medically necessary decisions for their children, nor have abandonment and neglect charges on our records. This is not just our story. It's a growing crisis in our state. Without clear legal protections, more families will be forced to choose between personal community safety or legal ramifications. We are urging you to support legislation that prevents families from being charged with neglect or abandonment for seeking or providing inpatient mental health care for a child. We would like to encourage cross-agency collaboration between mental health services and child welfare to ensure children receive treatment while families remain intact. providing training and guidelines for CPS and law enforcement to recognize legitimate mental health crisis care as a protective act, not a criminal act. Mental illness is at an all-time high, and we need to make a change. Sincerely and respectfully, Rain and Kimberly Alexander. Thank you very much.
Thank you, Kim. Thank you, Rain. I appreciate that very much. Chair, I was going to walk through some of the sections of the bill, but I don't think that's necessary. So at this time, I'd like to make it available for any questions.
Thank you so much. Questions from committee members? Just have a really quick one. It's more of a clarification. There's obviously considerations for parental bias if that were to exist, right? If a parent were, say, being frivolous and sending their kid to a treatment facility to mess with them, this doesn't give them immunity. It just says that, like, essentially, if that was the case, the child would still have the ability to go and contest it in court. So it doesn't give full immunity to parents in those situations. Is that correct?
Chair Kim Surratt, for the record, that is correct. I mean, it's stating that you cannot find a basis for abuse or neglect solely on the fact that they're seeking treatment. Your safeguard is a residential program or a treatment program is not going to accept a child that doesn't need it. You don't just get into those facilities just ad hoc. So that is a growing, what this bill doesn't fix is the fact that when we run out of facilities willing to keep the child because the child's so dangerous, it doesn't fix that problem of you now have the child at home and the child needs help and there's no facilities and there's no programs available any longer. But if a parent is forcing a child into regular everyday therapy, to be blunt, that's a parent's prerogative. Very few children think they need mental health assistance when good old therapy could help them. So, but that's not abuse or neglect. The issue here is when does it rise to the level of abuse or neglect? And just seeking treatment is all this bill is about. And the issue of having a dangerous kid at home that puts other people's safety at risk, that you took them home because you couldn't get them treatment, that having them around the others in the home is in of itself not neglect or abuse.
Great. Thank you so much. Any questions? All right. If you want to take a step back, we'll open it up for testimony. Again, the 15-15-15 rule applies. And so if you would like to support this bill, please come forward. And if our presenters in Southern Nevada can take a step back, that way we can have folks, please. I don't see anyone in support here, or let's see if there's anyone in Las Vegas. I don't see anyone. AVH, is there anyone online?
To testify in support, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you so much. Anyone in opposition, please come forward.
Good evening, Chair Donati, members of the committee. Joanna Jacob, JACOB, on behalf of Clark County. And I'm only up here under the rules in opposition because we'd like to see some additional work. As Senator Steinbeck said on behalf of the families, and I've spoken with Ms. Surratt, and I do not want to be opposed. I really don't want to be opposed to this because we absolutely 100% agree with the premise in this bill that parents who are doing everything that they should do and want to do for their children to seek appropriate clinical care for their children should not be penalized for doing that. And if they are advocating for their child not to be discharged from a facility because they're looking for a safety plan or they're trying to get that care for their children, we do not believe, even if it is reported to our agency, and I would like to say it may be reported to our agency, but then there is a process for us to substantiate whether that is actually abuse and neglect, but this is clarity in the law that we think is important. And I've been here before you all session talking about the importance of accurately funding policies made in this legislature. And I would like to say for the record, in 2019, this body passed a bill, AB 387, which would have helped this family if it had been funded and in place, because it required the state to wrap around services and to review every child who had been put into a residential facility and see what assistance they needed for 90 days post-discharge, and we would have wrapped around services and funding to assist these families. That is what we would like to see here. I don't want to be opposed. We'd like to continue to work on this bill, and so we're asking if you would consider moving it out of this committee so that we could continue to do so, and happy to continue to work on this on behalf of the families who support our kids. Thank you.
Ms. Jacob, I just have a question for you because I know that we have a day left before the deadline, and so I just want to make sure that we get the bill to a good spot.
Please, Joanna.
Is the pressure more so on the implementation of resources to actually solve the issue, or is the opposition? I guess is there an amendment that can help you get to neutral, or can get the bill in a better spot, or what would be the recommendation?
Senator Giannotti, if you want to recategorize me as neutral, I'm neutral on this policy. We don't need a change here. We'd like to keep working on it. Please move the bill as it is today. And I just the rules of this legislature is we might want something additional in the bill, so please move it today. That's my whatever you want to I don't know the category for this type of testimony. I guess I'm supportive of the policy, 100%. Don't need an amendment today. Go ahead and move it, and we'll continue to work on the bill. Thank you.
Thank you.
I don't know how you want to categorize it. Thank you.
That was exactly what I wanted to know, so thank you. Anyone else opposed to this bill? I don't see anyone here in Las Vegas. AVH, is there anyone online?
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. Let's go to neutral. Is there anyone that would like to testify in neutral on this bill? Seeing none, I don't see anyone here in Las Vegas. AVH, is there anyone online, please?
To testify in neutral, please press star 9 on your phone to take your place in the queue.
Hi, good evening. This is Anna Binder, ANNABINDER. I missed the opportunity because I was listening online to call in support of this. I am a mother to a son who has had to be institutionalized several times, and the aftercare and the case plan is so absolutely difficult to even put into place to bring a child home safely is so important. And so I do want to echo the lady I heard just before me, where if we could just please get this passed and make amendments after the fact. We're on a deadline. You guys know that. I appreciate your time. Thank you.
Chair, there are no callers in neutral at this time.
Thank you so much. Senator, do you have any closing remarks? Go ahead.
Thank you, Chair. Kim Surratt for the record. I just really wanted to quickly say that there was a statement about it being a growing problem in the state of Nevada. It's absolutely true, but it's a growing problem nationwide. The national groups are looking at it. There's a lot of groups looking at some very specific disorders, like reactive attachment disorder and the misunderstanding of it amongst social workers and mental health professionals. And the solutions are very complex, which is why the neutral/opposition/whatever it was testimony it was difficult, because it's a complex issue. And we really are urging and hoping for interim work of a group to roll up their sleeves and put the time and energy into fixing it, hopefully.
Thank you so much, and we greatly appreciate you for coming forward. We're going to go ahead and close the hearing at this time, and so we will now go on to our last bill for the hearing before the work session, Senate Bill 118, and so I'll invite Senator Stone to go ahead and move to the presentation table, and I'll open this hearing. This bill revises requirements relating to coverage under Medicaid for certain services provided by pharmacists. Senator Stone, you may begin when you're ready.
Thank you and good evening, Chair Donate, member of the committee, and I'll try to make this presentation as fast as possible. I'm Jeff Stone and I represent Senate District 20 from Mesquite, including Henderson, south to Laughlin. It's my pleasure to present SB 118, which proposes to revise requirements relating to coverage under Medicaid for certain services already provided by pharmacists. Senate Bill 118 does not expand the scope of practice for pharmacists. These are services that pharmacists already are authorized to provide under existing law. What this bill is address a gap in how these services are supported under Medicaid. Right now, when a physician, physician assistant, or advanced practice nurse provides a clinical service, they can bill Medicaid for it and receive reimbursement. Pharmacists, on the other hand, can only bill for a narrow set of services, even when they are delivering the same care within their scope of practice. As a result, many clinical services that pharmacists are trained, authorized, and ready to provide simply aren't being offered on a wide scale in Nevada because there's no mechanism to pay for them. SB 118 would change that. It ensures reimbursement for pharmacist-provided services and helps us tap into an existing healthcare workforce to address Nevada's ongoing provider shortage. If we're serious about improving patient care access in our state, this is a necessary and timely policy shift. Joining us on Zoom today, I hope, are my co-presenters, two experts who bring valuable insight on payment for clinical services for pharmacists. First, Dr. Ken Kuhnke, Executive Director for the Nevada Pharmacy Alliance. Dr. Kuhnke will walk us through the key provisions of the bill, explain why this is important, and what states allow billing clinical services through Medicaid. And then next, we'll talk to Dr. Zach Roscoe, Director for the Center for Advancing Pharmacy Practice and Research Excellence at Idaho State University. He will be here to answer any questions from the committee regarding the medical billing and the clinical services provided by pharmacists. And I hope we're still joined here by Dr. Kiko Duncan, Director for Pharmacy for the Department of Health and Human Services. And with that, I would like to pass it over to Dr. Kuhnke.
All right, thank you so much. Thank you so much, Senator Dunyate and the members of the Senate Health and Human Services Committee. My name is Ken Kuhnke, and I am the Executive Director of the Nevada Pharmacy Alliance. Today I'm here to present a few things about Senate Bill 118. So a couple things that I wanted to just clarify before I started. When people think of pharmacists, they think of the dispensing roles that pharmacists do. Receiving the prescription, packaging that prescription, getting the medication to the patient and counseling on him. This bill does not have anything to do with the dispensing services. Those are actually billed through pharmacy benefit managers, and we're not changing anything about that. What this does affect is clinical services provided by a pharmacist. So these are direct patient care activities that require professional judgment and clinical decision-making skills, such as like checking blood pressure, complete medication reviews, or helping with chronic conditions like diabetes or asthma. These type of services are billed through the regular medical insurance, just like a doctor, PA, or nurse practitioner. The substantive changes are pretty easy on this bill. Section 1, Medicaid must cover services provided by a pharmacist that are within this authorized scope of practice of the pharmacist and are covered when provided by another healthcare provider. Medicaid must cover clinical services provided by pharmacists in line with other healthcare providers, such as the number of times the service is covered, the amount that is reimbursed, and the prior authorization criteria. Why do we need this bill? As you know, we have a shortage of primary care professionals here in Nevada. We rank 48th, and pharmacists are trained and already doing these clinical services, but not on a wide-scale basis because we cannot bill Medicaid for them. So in 2004, all pharmacists have to graduate with their Doctor of Pharmacy degree. And in that Doctor of Pharmacy degree, they have to get at least 1,740 hours of clinical practice focusing right on patient care. There's a lot of studies out there that show that when a pharmacist is part of the medical team, that it does improve patient care and it does decrease the cost of healthcare. Like I said, there are a lot of service. This does not touch the scope of practice for pharmacists in Nevada. Since 2021, the Senate and the Assembly have opened up services that pharmacists can do, such as opioid use disorder, hormonal contraception, and HIV prevention. And in those bills, it was stated that Medicaid would have to pay for those services. There were some clinical services that were around from before 2021 that we currently don't have billing codes to actually tied to our NPI numbers where we can bill for them. One of those things is medication therapy management. So if a pharmacist is working inside a healthcare facility, such as a clinic, and a doctor, a PA, or a nurse diagnoses that patient with diabetes, in a lot of situations, the next time the actual patient comes in, they can actually schedule a patient with the pharmacist, and the pharmacist can go over their medications with them, the drug interactions, how to take it, create a plan, refer the patient out to other providers as needed. But right now, it's not happening widespread because we cannot bill Nevada Medicaid for it, and that's what this bill would actually cover. In 2022, Maryland actually looked at a bill like this. It did not pass, but they put together a interim work group. It was a senator, it was the Maryland Medicaid, colleges of pharmacy, health insurance, like I said, the Medicaid, and they did say that this would be a good policy to pass, and they recommended that it actually be reintroduced in 2023, and it did pass in 2023. If you look here, these are the states that actually pay for clinical services for pharmacists. Right now, Nevada is pink, which means that we can only get reimbursed for the specific scope of services. The blue states and the teal states all require Medicaid payment for clinical services for pharmacists. In SB 118, we're actually asking to go to the green things where everything that we're allowed to do under our scope has a billing code and we're actually able to bill it. So that is my whole presentation. I wanted to keep it short. There are references, and we have Dr. Zach Roscoe. He does a lot of the billing in other states, and he knows the ins and outs, but he doesn't have anything to share right now, but he is available for questions. So I will pass it back over to Senator Stone.
It's on. I hope. Chair Donati, that concludes our presentation. We're open for any questions for either myself or my two doctor colleagues.
Thank you so much, Senator Stone, and to your co-presenters. Committee members, do we have any questions? Senator Titus.
Thank you, Senator Stone. I know that you have been working hard on this bill, and I appreciate what you do and that your two presenters. I'm curious about looking at your page, clinical services allowed in Nevada, that particular page of the document that you gave us at our tables. Yeah. And I can share that with my senator to my left here. Yeah. And so under the question I have about the collaborative practice agreement services, so in that block there it says you're doing diagnosis, you're actually ordering lab work, and then you're prescribing medication. So that's really a complete treatment plan. Do you do a physical exam at that time, or do somebody just tell you, hey, I have a headache, then you order a lab, and then you prescribe medication? I'm just really curious how, to me, that's practicing medicine through physical diagnosis, examining, et cetera. And so just curious, what does that look like in the pharmacist world?
Thank you, Senator Titus, for the question. I'm going to defer to Dr. Kunke, who is going to talk about collaborative practices and what pharmacists are doing every day here in Nevada.
Yeah, thank you so much, Ken Kunke, for the record. So the clinical practice scope is actually already in law. It's been changing, I think, since around 2014 or 2015, or 2015, I think it started. But the actual what the pharmacist can do is 100% between the provider and the pharmacist that are actually signing the collaborative practice agreement. What they have to do is they have to follow certain things that are in the regulation, and then they submit it to the Board of Pharmacy, and then they can actually diagnosis as part of that. If that doctor, that nurse practitioner decides that's what the pharmacist should do, and they're trained that way, they're able to do that.
So I'm curious then, in your pharmacy training in college, if I might follow up, Mr. Chair, do you get that training then, or does this come after you have graduated with your PharmD degree, then whatever the scope of practice that you now agree with, and it can be a PA, perhaps, a nurse practitioner that's given you this authority?
Ken Kunke for the record. Yes, that is correct. In our actual statute and regulations, it could be a physician's assistant, a nurse practitioner, or an MD or DO. Right now, there are other states that have advanced pharmacist practitioner training that actually does teach diagnosis. And we do have a lot of pharmacists that go through that type of stuff. I know that there's one out of New Mexico. The American Pharmacists Association has a training also. As for what is needed to be done here in Nevada on the training on that, that would be up to that individual doctor, nurse practitioner, or physician's assistant.
Any other questions? Okay, thank you. All right, I don't think we have any questions, and so we'll go ahead and open it up for testimony. So, Senator Stone, if you want to take a step backwards. All right, if you would like to testify in support of this bill, please come forward. And it looks like we'll start here in Carson City, so you may begin.
Good evening. For the record, my name is Adam Porath, Adamporath, and I represent the Nevada Society of Health System Pharmacists. Again, NVSHP is a member organization in the state that represents the pharmacists and pharmacy technicians working in hospital and health systems in our state. I'm here today in strong support of SB 118. I've had the privilege of working as a practicing pharmacist in the state for 19 years. 10 of those have been in direct patient care through a collaborative practice agreement. We actually started making changes through this body in 2011 that allowed some of the scope expansion that we see today. Fast forwarding to where we can work under collaborative practices to co-manage patients for a variety of disease states. Study after study has shown that when you involve a pharmacist and patients in a patient's direct care, their outcomes improve and it saves the health system money on the order of an ROI of 4 to 1. Over the last few sessions, expansion of pharmacist practice included independent prescriptive authority for HIV prophylaxis medications, oral contraceptives, and medications for opioid use disorders. In all of these cases, there was a specific provision to include a payment mechanism for these services under Medicaid. SB 118 will allow pharmacists to be compensated for all the clinical services to Medicaid patients that they are capable of providing under their scope of practice, including, and most importantly, the work being performed under collaborative practice agreements. Without an adequate payment mechanism for collaborative practice of pharmacy, to date, adoption of these services have been pretty sparse in Nevada and limited to settings like hospitals and FQHCs where other reimbursement helps support the work indirectly. Today, we are missing a large opportunity in Nevada to help patients where they can access pharmacist care services more readily in community pharmacies and primary care clinics. Ultimately, this bill provides the opportunity to expand access to care for Medicaid patients, improve outcomes, and save the state healthcare dollars. I would strongly urge your support to move this bill forward to work session. Thank you.
Thank you, Chair and members of the committee. Bradley Mayer, partner with our Argenta partners here on behalf of Southern Nevada Health District. The Southern Nevada Health District through the Southern Nevada Community Health Center, which is our federally qualified health center, has a goal, of better serving the community through pharmacist-led services. And as was mentioned before, we already can receive this reimbursement with HIV, contraception. This will really allow us to better serve the community by expanding that within our current scope of practice, as was said already. And so we ask you for your support. Thank you.
Thank you so much. Anyone else here? I don't see anyone here in Las Vegas AVH. Is there anyone online?
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue.
Hi, my name is Lisa Hamill. I am a pharmacist with Smith Pharmacy in Las Vegas, and I would like to, last name Hammel, I would like to express my support for this bill and how it would greatly increase our ability to help our communities.
Good afternoon. My name is Evan Williams, and I'm representing the Nevada Pharmacy Alliance tonight. And the Nevada Pharmacy Alliance is in strong support of SB 118. To be clear, this bill does not expand scope of practice. This is stuff that is already happening in our clinics across Nevada. These authorities have already been granted by the legislature, by the Board of Pharmacy, and these are already happening. In doing this will expand these services so that you have better access to care. It will reduce burdens on physicians and other healthcare providers because pharmacists now will have a financial incentive to become more engaged in preventative care. Currently, these services are being offered, but there's not a great financial incentive for any doctor's office to use a pharmacist as an extender to provide these services because the billing is so convoluted. And what happens now is that there is maybe a cash pay system, which creates a disparity between some constituents who can pay and afford to do that by cash, and then some that are not able to. Doing this will align with national trends and best practices. We have 15 states already pay pharmacists through Medicaid, so Nevada would just be joining that best practice. And again, this is not expanding scope, it's stuff that's already being done. And so if any other provider is providing healthcare services and they're getting paid for it, a pharmacist who's providing that same service should be able to get paid for it. Establishing a payment pathway will allow other clinics to go ahead and bring that on. I would like to point in Nellis here to the exhibit for this bill and note that there are 11 letters of support with over 50 signatures on this from pharmacies, pharmacists, patient advocacy groups, physicians, physicians assistants, and nurse practitioners. There are lots of signatures here in support of this bill. And this is something that I think certainly with providers who work closely with pharmacists understand that there is value here. So to reiterate, the Nevada Pharmacy Alliance is in strong support of SB 118, and we hope that the committee votes to move it forward. Thank you.
Good evening, Chair Dunyate and members of the committee. I'm Steve Messenger, Messinger. I'm with the Nevada Primary Care Association representing the state's federally qualified health centers. Integrated pharmacy services are essential to the care that our member community health centers provide. In fact, the fastest growing department in our health centers is pharmacy, rising more than sixfold from 10 FTE in 2013 to more than 64 in 2025. Serving the most vulnerable Nevadans who often lack health insurance, transportation, and access to affordable medications, our health centers have pioneered models of increasing pharmacist responsibilities in managing chronic disease. Medicaid and Nevada's taxpayers benefit from our ability to expand access through pharmacy services and drive performance by maximizing the scope of these critical healthcare providers. We believe that pharmacists can do much more to increase access with Medicaid reimbursement, and for that reason, we thank Senator Stone and urge passage of SB 118.
Hi, good evening. My name is Amanda Villa, spelled Villa. I am a practicing pharmacist in Henderson, Nevada with Walmart. So as a pharmacist that's already performing these services at a retail or community setting, the items that are addressed in this bill, such as medication therapy management, test and treat services, including flu, strep, COVID testing, point of care services, such as A1C testing, blood pressure, and cholesterol testing, as well as hormonal contraceptive prescribing, all, again, which I already perform at a retail or community pharmacy setting. I highly and strongly support SB 118. Again, this does not expand a pharmacist's scope of practice. These are already performed, sometimes on a day-to-day basis, under a collaborative practice agreement. Currently, Medicaid patients are not able to access these services unless they are paying out of pocket because these services cannot be billed to Medicaid.
Expanding this and being able to bill Medicaid for these services could help avoid added expenses to other healthcare settings like emergency rooms or urgent cares, overall improve patient outcomes and lower cost of healthcare, and then help with the burden sometimes placed on emergency services. Especially in the retail and community setting, this would expand access to services that would be given by possibly more accessible and highly trained pharmacists. Again, this is just to reiterate that I strongly support SB 118. Thank you.
Hi, this is Jeannie Smith. I am the Chief Pharmacy Officer at Nevada Health Centers. We are the largest F2HC in Nevada. We have clinical pharmacists already providing these services. Our services reduce burden on the providers and provide more access points for our patients in rural areas and also our underserved patients who may not get care otherwise. We have a system where patients are collaboratively managed with both their medical providers and the pharmacist team. And this would just allow us to get payment for services that we are already providing and expand our services so that we can reach more patients in Nevada. So I'm in strong support of this bill, and thank you for your time.
Hello, my name is Nancy, Nancy Cadigan, Caddigan. I am a pharmacist and I work within the Washoe Tribal Health Center. I'm also a member of the Nevada Pharmacy Alliance. We do this in our health center. We have clinical pharmacists that do MTM and work closely with our providers. However, there's many times where we're not getting reimbursed for them. We're doing it anyway because it's the best thing to do for our patient population. I strongly support this bill. It does not increase our scope. It makes pharmacy and healthcare in general better for everyone, and especially the least of our population. Thank you very much.
U.S. law requires.
Hello all, my name is Amy Hale and I'm a pharmacist licensed in Nevada, and I do sincerely apologize for the background noise as I am boarding a plane, but as a former director of pharmacy, had our pharmacists been able to receive payment for the services we already perform, I could have hired more pharmacists to expand the program and reduce the burden on our providers who are routinely double and triple booked. I testify in strong support of SB 118 and sincerely thank you for your time tonight.
Thank you so much for your comment. That's commitment right there. I can take two more, please.
Good evening, Chair Donate and members of the committee. For the record, Liz McMenamin, MACMENAMIN, with the Retail Association of Nevada, representing the community pharmacies in Nevada. The community pharmacist is one of the most trusted and accessible healthcare providers for patients in Nevada. Implementation of SB 118 would allow savings to the Medicaid program through less emergency room visits, hospitalizations, and the reduction in disease management progressions. These changes in other states have shown overall savings for their healthcare systems. Compensating pharmacists and pharmacies for clinical services would help mitigate Nevada's primary care provider shortage and will keep community pharmacy door open and give patients in Nevada the ability to access much needed health care. We appreciate your time. We thank you. We know the hour's late, and we urge you to move this out of work session or into work session and move forward with helping the patients in Nevada. Thank you.
There are no callers in support at this time.
Thank you so much. Let's move on to opposition. If there's anyone in opposition, please come forward. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And last but not least, anyone in neutral? I don't see anyone here or in Las Vegas. AVH, is anyone online?
And to testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. Senator Stone, if you can come back forward. I think I have a question, a clarifying question I just thought of, and then Senator Titus has one, but I'm going to let Senator Titus go first.
Thank you, Mr. Chair. Thank you for the presentation and all the folks that have called in for you. I just thought a couple things just for clarity. Who has the liability for a misdiagnosis or a mistreatment? Where's the liability fall? Is it on the pharmacist or is it on the collaborative provider, the physician, the PA, the nurse practitioner?
Senator Jeff Stone, for the record, I'm going to defer to Dr. Kunke. If he's still there, I hope he's still there. Yes.
Yeah, Ken Kunke for the record. I think that goes back to standard of care, where it would depend on what happened and what type of oversight was missed. I think both providers could be held liable for anything that was done in malice. But I'm not 100% sure. I don't know, but I know that I think both providers would.
And just a quick follow-up on that. So when, and don't get me wrong, when as a practicing physician, I worked with my pharmacist, and actually I signed off as his collaborative physician, and he's the guy that I had give me my shots. I mean, because I trusted him and liked how he gave shots, and so I'm not against the concept. The second question I had was regarding reimbursement. It sounds like you charge for this already and patients have to pay you cash. I'm hearing the word cash payment.
Senator, yes, there are some locations where, this is Zach Roscoe for the record, ROSKO. Some locations are presently offering these services and they may be on a cash pay basis. There may be some services that are currently delivered and covered under commercial medical benefits if a contract has been established.
That was going to be my next question. Are there commercial contracts throughout the nation, any in the state, that already pay for these services, private insurances?
Again, Zach Roscoe for the record. Many of the same commercial payers that offer plans in Nevada are covering pharmacist services in other states. That includes a variety of states that have mandates for coverage of pharmacist services under commercial plans, but there are many who elect to cover pharmacist services based on benefits to them that they've seen either in other states or they recognized.
And last question, and I know Ms. Weeks is here, and I know she's so bored that she sat in all these committees all day long. But I'm curious if if it's already standard practice and Medicaid has been okayed, or is this something you'd have to apply for another waiver for?
Mr. Chair, Stacey Weeks for the record. No, we would not need a waiver for this.
Hold on, I got another one. Don't go so soon.
Not so fast.
Okay, so I have a question. So just tagging along to what Senator Titus was mentioning. So I want to make sure that I'm clear on this. So in the slide deck that you provided, obviously it's the clinical services allowed in Nevada. Medication therapy management, collaborative practice agreement services, and health screenings are services that you cannot currently bill under Nevada Medicaid. Remind me again, I know we had this conversation in 2023. For these three that are not covered under Medicaid, was there a state law that was passed that required it on the commercial plans already? Because I know and it's going to dive into my second question.
All right, thank you so much, Senator Dunyate, for the question. Ken Kunke for the record. We tried to pass SB 201 in the 2023 session. That included both Medicaid coverage and commercial coverage. That did not pass in any form. When we brought it back in 2025, we decided to only go with Medicaid coverage mandatory because commercial can still elect to pay for the coverage. So we thought it would be a good stepping stone where we went with Medicaid first because we need the billing codes tied to our NPI numbers, and we can't bill Medicaid without that. But commercial insurances, we can bill, and then they may pay for it. They don't have to in the state of Nevada right now.
Thank you. So I just want to, I'm having recollection of, there was, maybe you might remember this, there was a conference committee towards the end of last session that may have included this, but there was no, so just to make sure that we're on the same page, right now for the medication therapy management, collaborative practice agreements, and health screenings, this is not a requirement for commercial plans in Nevada. Just making sure that we're on the same page.
Thank you so much, Senator Dunyate. Ken Kunke for the record. No, there is no mandate for commercial plans to cover those services in Nevada.
Okay, thank you. So now this is for Medicaid. I think the difficulty that we experienced last time was that pharmacy services are a little bit different because there's no direct payment to the provider. Oftentimes it's you go and pay it through the institution, right? And so if they work at a CVS and so forth. And so is there a concern, or is there essentially, maybe it's not concern, but are there going to be some implementation requirements that we're going to have to go through in order to be able to facilitate the reimbursement of these services now?
Chair, committee members, Dr. Duncan for the record. We already have a provider type specific for pharmacists that has already been implemented because of those other bills that have previously passed. So, excuse me, wheezing. So there wouldn't be any additional creation of a new provider type on Medicaid's side. We would simply be adding in additional class codes essentially for that billing.
Got it. Thank you so much. I just wanted to make sure that was clear based on the conversation from last session. All right. Thank you so much, Senator Stone. And if you guys can go ahead and take a step back, I'll go ahead and close the bill hearing for this bill, and we will wait for Senator Stone to come back so that we can begin on our work session. Yeah. All right, let's begin our work session. I want to make an announcement that the bills that were heard today may or may not be reflected on tomorrow's work session. We do have a couple bills still outstanding for work session, including the ones from today. And so I just want to make sure that I'm transparent that there will be a work session tomorrow. The question now becomes what time it's at. So we'll figure out the way of order. And so, again, the bills that were heard today will not be work session today. They'll be work session tomorrow, whatever time that is. Let's start with our first bill, Senate Bill 8. Ms. Cooper.
Destiny Cooper, Committee Policy Analyst, Research Division, LCB. As nonpartisan staff, I cannot advocate for or against any measures before you today. Senate Bill 8 revises provisions relating to services provided by the Aging and Disability Services Division of the Department of Health and Human Services. It's sponsored by the Senate Committee on Health and Human Services on behalf of ADSD. It was heard on February 11th. In summary, Senate Bill 8 revises terminology regarding individuals with disabilities served by the Office of the Attorney for the Rights of Older Persons and persons with a physical disability, an intellectual disability, or a related condition. The bill substitutes the term related condition with developmental disability and revises the definition of intellectual disability to ensure alignment across related services. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions on this bill? Seeing none, I'll go ahead and take a motion to do pass Senate Bill 8.
So moved.
We have a motion from Vice Chair Taylor, second from Senator Lang. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I will go ahead and take that floor statement. Let's move on to Senate Bill 24. Ms. Cooper.
Thank you, Chair. Senate Bill 24 provides for the certification and regulation of emergency medical responders. It's sponsored by the Senate Committee on HHS and on behalf of the Division of Public and Behavioral Health of the Department of Health and Human Services. Senate Bill 24, in summary, adds emergency medical responders as a recognized pre-hospital medical provider in statute to comply with federal law. Additionally, this bill prohibits a person from representing himself or herself as an emergency medical responder unless the person holds a valid certification as an emergency medical responder and subjects those who violate this prohibition to certain penalties. Thank you.
Thank you so much. Committee members, any questions? This one's a motion to do pass. We have a motion from Vice Chair Taylor, second from Senator Lang. Any discussion on this bill? All those in favor, please say aye. Aye. Any opposed? We have a nay from Senator Titus. Motion carries, and I'll go ahead and assign that to Vice Chair Taylor. Let's move on to Senate Bill 84. Ms. Cooper.
Thank you, Chair. Senate Bill 84 revises provisions relating to domestic violence, sponsored by the Senate Committee on HHS on behalf of the Joint Interim Standing Committee on Judiciary. It was heard on February 27th, and in summary, Senate Bill 84 adds a requirement that the curriculum and instructional materials used in programs administered by the Division of Public and Behavioral Health for the treatment of persons who commit domestic violence to be evidence-based. Thank you.
Thank you so much. This one's the motion to do pass. We have a motion from Vice Chair Taylor, seconded from Senator Lang. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I will go ahead and assign that floor statement to Senator Lang. Let's move on to Senate Bill 137. Ms. Cooper.
Thank you, Chair. Senate Bill 137 requires the establishment of a program relating to medical emergencies. It's sponsored by Senator Neal and was heard in committee on February 11th. Senate Bill 137 requires the Division of Public and Behavioral Health to establish and operate a program related to public health to improve, 1, the ability of people in the state to respond to medical emergencies, and 2, access of people in the state to resources for responding to a medical emergency. Additionally, this bill requires a program to include certain measures relating to increasing the number of volunteers trying to assist in medical emergencies. Thank you.
Thank you so much. This one's a motion to do pass. Do I have a motion? Oh, thank you. Motion from our Vice Chair, second from Senator Lang. Any questions on the bill or any discussion? Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I'll assign that to Senator Neal. Ms. Cooper, let's go to Senate Bill 182.
Senate Bill 182 revises provisions relating to the staffing of healthcare facilities. It's sponsored by Senator Nguyen. It was heard on March 6th, and in summary, Senate Bill 182 requires each hospital to establish a staffing committee that oversees additional staffing committees for the purpose of representing technical and service workers of the hospital. This bill also requires such committees to collaborate and develop certain plans relating to adequate staffing and report them to the legislature. Lastly, this bill requires ratios for the maximum number of patients who may be assigned to a direct care nurse in a hospital. Senator Nguyen proposed the following amendment, which in summary revises the definition of direct care nurse, adjusts the ratio requirements around patient safety and direct observation, adds language to allow for collectively bargained ratios to supersede certain ratios, and lastly provides an exemption for psychiatric hospitals. Thank you.
Thank you so much. This one is an amend do pass. Do we have any questions? I'll go ahead and take a motion to amend do pass. We have a motion from our Vice Chair and a second from Senator Lang. Let's go on to discussion. Senator Titus.
Thank you, Mr. Chair. Unfortunately, although I do respect what the sponsoring senator trying to do, the fact that they were willing to negotiate with a number of parties, I am very, very concerned about mandating ratios, and that the unintended consequence will be the hospitals won't close, but certainly availability of hospital beds will be, because they won't have the staffing. And so I'm very concerned that this is going to do the opposite of what the intent is, and I'm a very hard no on this one. Thank you.
Thank you, Senator Titus. Any other discussion? Vice Chair.
Thank you, Mr. Chairman. Just to kind of respond to or converse a little bit with my colleague Senator Titus, my understanding is that it wouldn't, that there are always exemptions or waivers so that you don't have that situation if you don't have the staff. So that gives me a level of comfort that I wouldn't have otherwise had. Thank you, Mr. Chairman.
Thank you. Any other discussion? The only comment that I want to make is Obviously, this was one of the biggest hearings that we had this session for this committee. I know that the sponsor and I have met on this bill several times, and she has made amendments, which we are about to approve right now. My only ask is I have not seen an amendment from the dissent, and clearly there's more work to be done. And so I would just ask that as the bill moves forward, that we offer that commitment, not just to the sponsor of the bill, but also to the nurses of the state. And so I just would respectfully request that as the bill moves forward, that at least this is accomplished in the other house because it wasn't accomplished in this one. So I will go ahead and move on to the vote. So all those in favor, please say aye. Aye. Any opposed? We have a nay from Senator Titus and Senator Stone. The bill carries forward, and we will assign that floor statement to Senator Nguyen. Let's move on to Senate Bill 183. Ms. Cooper.
Thank you, Chair. Senate Bill 183 revises provisions relating to caseworkers of agencies which provide child welfare services, sponsored by Senator Scheibel, heard in committee on March 13th. Senate Bill 183 prohibits a child welfare services agency from assigning more than 30 cases of children who are in the custody of the agency to a caseworker who provides permanency services. Senator Scheibel proposed the following amendment, which in summary creates an exception for children in the custody of the agency to be assigned to the same caseworker as their sibling, and creates an exception to provide that upon the declaration of an emergency, the director of DHHS may grant temporary authority to assign more than 30 children to a caseworker who provides permanency services. Thank you.
Thank you, Ms. Cooper. Any questions? This one is an amend do pass. We have a motion from our vice chair, seconded from Senator Lang. Any discussion? Senator Titus.
Again, I thank the sponsor of this bill, and actually I do appreciate the intent and also the fact that there was some pretty good hefty negotiations about the unintended consequences and the impact. And with the amendments, I'm going to support this bill, and thank you for all those who worked hard on it.
Thank you, Senator Titus. Any other comments? Let's move on to the vote. All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will go ahead and assign that floor statement to Senator Scheibel. Let's move on to Senate Bill 188. Ms. Cooper.
Thank you, Chair. Senate Bill 188 establishes procedures to assist certain persons with limited English proficiency in accessing health care in certain circumstances, sponsored by Chair Doniate. It was heard in committee on February 25th. In summary, Senate Bill 188 codifies the federal mandate to ensure healthcare entities take responsible steps to ensure individuals with limited English proficiency have access to healthcare services. This includes, but is not limited to, free, accurate, and timely language assistance through qualified interpreters and technology. Senator Doniate proposed the following amendment, which, among other provisions, adds to the best extent possible to subsection 1 of section 7, strikes subsection 2B and subsection 3 from section 8, and revises the definition of a health facility. Thank you.
Thank you so much, Ms. Cooper. Any questions, committee members? This one's an amend do pass. Do I have a motion? We have a motion from our vice chair, seconded from Senator Lang. Any discussion? Senator Titus.
Thank you, Senator Donate, for bringing the bill. I understand this was a personal one to you through your experiences, and as much as I would like to support it, I'm going to be a no, and perhaps I can get to a yes at some point after I look at the amendment and really reach out to some other folks. Thank you, sir.
Thank you, Senator Titus. Any other discussion? All right, let's go ahead and move on to the vote. All those in favor, please say aye. Aye. Any opposed? Nay. We have a nay from Senator Titus and Senator Stone. The motion's carried, and I will take that floor statement, and my dad better tell me thank you. Let's go to Senate Bill 234, Ms. Cooper.
Senate Bill 234 makes revisions relating to Medicaid. It's sponsored by Senator Doniate, etc. Senate Bill 234 requires the Director of Division of Healthcare Financing and Policy to include under Medicaid coverage for care necessary to treat an emergency medical condition of a resident under the age of 18 who would otherwise be ineligible due to immigration status. This coverage is required to include, without limitation, emergency medical transportation services directly relating to the treatment of the emergency medical condition, care to treat the emergency medical condition provided in an emergency room or similar setting, and inpatient services provided to a person following the admission of the person from an emergency room, clinic, or other similar setting where original treatment was sought. Additionally, this bill requires DHHS to apply for any federal waiver or law to amend the state plan for Medicaid to obtain federal financial participation. Senator Doniate proposed the attached amendment, which in summary revises the age range from 18 to 21, among other provisions. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions? This one's an amend do pass. Do I have a motion? We have a motion from our vice chair. Do I have a second? Second from Senator Lane. Let's move on to the discussion. Any discussion? All those in favor, please say aye. Aye. Any opposed? We have a nay from Senator Titus and Senator Stone, and I will take that floor statement. Let's move on to our next one, which is Senate Bill 250. Ms. Cooper.
Thank you, Chair. Senate Bill 250 revises provisions relating to healthcare records. It's sponsored by Senator Lang, etc. It was heard in committee on March 18th. In summary, Senate Bill 250 provides that electronic health records are the property of the patient and requires healthcare providers to, 1, allow a patient to forward his or her electronic health records to any other person or entity without a fee or charge, allow a patient to secure access to his or her EHRs without a fee or charge, and ensure that upon a patient's request to furnish EHRs to himself or herself or another entity, the records are transmitted in accordance with NRS 629.062. Senator Lang proposed the following amendment, which in summary removes Section 2 in its entirety relating to the health repository, removes the word electronic from Section 3 so all health records are property of the patient, not just those in electronic form, allows a patient secure access to his or her EHRs without a fee or charge, and lastly, allows a patient to forward his or her each EHRs to any healthcare provider or personal representative who can make healthcare decisions for the patient without a fee or charge as defined in NRS 439.583. Thank you.
Thank you so much, Ms. Cooper. This one is an amend due pass. Do I have a motion?
Let's give it to Senator Titus.
Let's give that to Senator Titus in a second from our vice chair. Any discussion on the motion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I'm going to assign that floor statement to Senator Lang. Let's move on to Senate Bill 257. Ms. Cooper.
Thank you, Chair. Senate Bill 257 revises provisions relating to autism. It's sponsored by Senator Dondero Loop, etc. It was heard in committee on March 18th, and in summary, allows for any provider of healthcare acting within their scope of practice to conduct autism spectrum disorder services instead of limited these services to specific provider types. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions on this bill? This one is a due pass. Do I have a motion? We have a motion from our vice chair, seconded from Senator Lang. Any discussion? Senator Titus.
Thank you, Mr. Chair. I appreciate what the intent of this bill is. Unfortunately, I will not be able to support it. The diagnosis of autism and early intervention is the key, but you want to make sure that it's the correct diagnosis. Misdiagnosing children with autism or whatever that spectrum is really critical, and so I'm worried about the expansion of who can do that diagnosis. So I will be a no. Thank you.
Thank you so much. Any other comments? Let's move on to the vote. All those in favor, please say aye. Aye. Any opposed? Nay. We have a nay from Senator Titus, and I'll assign that floor statement to Senator Dondero Loop. Let's move on to Senate Bill 284. Ms. Cooper.
Thank you, Chair. Senate Bill 284 revises provisions relating to child welfare. It's sponsored by Senator Canizaro, etc. It was heard in committee on April 3rd, and in summary requires an agency that provides child welfare services to 1, determine if each child in the custody of the agency is receiving or is eligible to receive federal benefits through the Social Security Administration or the United States Department of Veteran Affairs within 60 days of custody, and apply promptly for federal benefits on behalf of the child if they determine a child is eligible but is not currently receiving the benefits. Additionally, this bill requires a child welfare agency to establish an account for the child to conserve federal benefits received instead of reverting the funds to the state treasury for credit to the trust fund for child welfare. Lastly, this bill requires the agency to provide certain financial counseling for the purpose of financial stability upon exiting the system. Senator Canizaro proposed an amendment which revises the effective date to January 1st, 2026. Thank you.
Thank you so much, Ms. Cooper. This one is do we have any questions? This one is an amend due pass. I'll take a motion. We have a motion from our vice chair, second from Senator Lang. Any discussion? Senator Titus? Oh, no. Yep. This is discussion.
Sorry. Thank you, Mr. Chair. It's late. I appreciate that, and I also appreciate what the presenter of this bill, the sponsor of this bill, is trying to do. And certainly, we want to have children as they are leaving foster care, some support in that process. However, my concern is that these funds, and when a child is qualified for federal funds, as we would as a parent or anywhere, those funds are intended to take care of that child and offset food and clothing and some of the parts of raising the child. And so to then put this whole raising now onto the backs of the systems, the counties, et cetera, I think is not fair and not what the original intent of the funds that the child will be getting were intended to. So I will be a no on this. Thank you.
Thank you so much. Any other comments? Let's move on to the vote. All those in favor, please say aye. Aye. Any nays? We have a nay from Senator Titus and Senator Stone. The motion carries, and I will assign that to Senator Canizaro. Let's move on to Senate Bill 299. Ms. Cooper.
Thank you, Chair. Senate Bill 299 revises provisions relating to senior living communities, sponsored by Senator Dondera Loop, etc., and it's heard in committee on April 3rd. Senate Bill 299 removes the requirement for a senior living community referral agency to obtain a license from the State Board of Health, and instead requires the same agency to register with the Division of Public and Behavioral Health. Additionally, this bill requires DPBH to adopt regulations to carry out the provisions of this bill and allows for a senior living community referral agency to continue to operate until 120 days after the regulations are adopted with a license from the board. Senator Dondera Loop proposed the attached amendment, which in summary removes the requirement that DPBH charges a fee to apply for or renew registration as a senior living community referral agency, while still authorizing the State Board of Health to charge such a capped fee. Thank you.
Thank you so much. Committee members, any questions? This one is amend do pass. We have a motion from our vice chair. We have a motion from Senator Lang and a vice chair from a second from our vice chair. Any discussion on this?
It was Titus.
Oh, was it?
Yeah.
Oh, okay. I will reverse that. I will give the motion to Senator Titus and the second from our vice chair. All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I'll give that floor statement to Senator Dondera Loop. Let's move on to our next bill, Senate Bill 306. Ms. Cooper.
Thank you, Chair. Senate Bill 306 revises provisions relating to mental health services for children, sponsored by Senator Cruz Crawford, and Assemblymember Mosca. It was heard in committee on April 3rd. Senate Bill 306 requires any public or private inpatient psychiatric facility authorized to receive reimbursement from Medicaid for services provided to a child with an emotional disturbance to accept a child for treatment with certain exceptions. Additionally, this bill requires certain facilities to create discharge plans under certain circumstances, which are shared and agreed upon by each parent or legal guardian before the child is released. Senator Cruz Crawford proposed an amendment which in summary revises discharge requirements and procedures and revises provisions relating to timely access of clinically appropriate psychotropic medication. Thank you.
Thank you so much. Any questions? This one is an amend do pass. Do I have a motion? We have a motion from our vice chair, second from Senator Lang. Any discussion on this bill? Seeing none, all those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will go ahead and assign that floor statement to Senator Cruz Crawford, and congratulations on getting your first HHS bill out. Let's move on to Senate Bill 330. Ms. Cooper.
Thank you, Chair. Senate Bill 330 revises provisions relating to facilities for skilled nursing, sponsored by Senator Neal. It was heard in committee on April 1st. Senate Bill 330 revises the definition of a facility for skilled nursing to clarify that facilities for skilled nursing provide inpatient care. Senator Neal proposed an amendment which in summary revises provisions relating to ordinances and can be found attached.
Thank you so much. Committee members, do we have any questions? This one is an amend do pass. Do I have a motion? Motion from our vice chair, second from Senator Lang. Any discussion? Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? We have a nays from Senator Titus and Senator Stone. Motion's carried, and I'll assign that floor statement to Senator Neal. Let's move on to Senate Bill 390. Ms. Cooper.
Thank you, Chair. Senate Bill 390 revises provisions relating to the support of children, sponsored by Senator Neal, heard in committee on April 1st. Senate Bill 390 authorizes rather than requires the district attorney or other public agency to provide a report with the name of the person who has failed to comply with the subpoena or warrant relating to child support to the Department of Motor Vehicles. Additionally, this bill provides that a person is not in arrears of child support payments unless the person is delinquent in payments for no less than 6 months or has failed to provide medical insurance for a child as required by a court order. Senator Neal proposed an amendment which is attached. It revises the definition of delinquency from 6 months to 3 months, amongst other provisions. Thank you.
Thank you so much. Committee members, any questions? Senator Lang.
Thank you, Mr. Chair. I am going to vote this out of committee, but I'm going to reserve my right.
Thank you. Any other comments? Senator Titus?
I am not going to support this, although I appreciate it lowering the time. I think that any time that they potentially could get reimbursed can impact a family. I remember standing in line at a grocery store one time where my family had credit, and I was told I couldn't charge anymore because my dad hadn't given any money to my mom to help offset that bill. So if those things do not happen, kids are affected. So I understand how this is trying to help, but I have to be also a hard no on this thing. Thank you.
Thank you. Any other comments? This one is a motion of amend do pass. We have a motion from our vice chair. Do I have a second? Do I have a second?
Sorry.
It's okay. We have a second from Senator Lang. Moving on to the vote. All those in favor, please say aye. Aye. Any opposed? Nay. We have 2 nays from Senator Titus and Senator Stone. The motion's carried, and I'll sign that floor statement to Senator Neal. Let's move on to Senate Bill 408. Ms. Cooper.
Thank you, Chair. Senate Bill 408 revises provisions relating to county hospitals and county hospital districts, sponsored by Senate Committee on Health and Human Services, heard in committee on April 8th. Senate Bill 408 replaces the term intern with residents and fellows in the list of employable personnel. This bill also authorizes a county or district hospital to enter into a contract to provide or form a separate organization to enter into a contract to provide crisis stabilization services or certain other mental health services. Among other provisions, this bill updates the name of an accrediting organization for medical residencies. Senator Doñate proposed an amendment which can be found attached and revises the list of employable personnel. Thank you.
Thank you, Ms. Cooper. Committee members, do we have any questions? This one is an amend do pass. Do I have a motion? We have a motion from our vice chair, seconded from Senator Lang. Any discussion? All those in favor, please say aye. Aye. Any opposed? Motion carries unanimously, and I will take that floor statement. And last but not least, Senate Bill 410. Ms. Cooper.
Thank you, Chair. Senate Bill 410 revises provisions relating to public employees. It's sponsored by the Senate Committee on Health and Human Services and was heard in committee on April 8th. Senate Bill 410 specifies that for collective bargaining purposes between a recognized employee organization and a local government employer, insurance benefits include, without limitation, insurance benefits for the dependent of a local government employee. Senator Doñate proposed an amendment which replaces dependent of an employee with cover dependent of an employee. Thank you.
Thank you so much, Ms. Cooper. This one is, well, do we have any questions on this one? This one is an amend do pass. Do I have a motion? We have a motion from our vice chair. Do I have a second? Second from Senator Lang. Any discussion? All those in favor, please say aye. Aye. Any opposed? We have 2 nays from Senator Titus and Senator Stone. The motion's carried, and I will go ahead and take that floor statement. That concludes our work session for today. Which will move us on to our last item on the agenda, which is public comment. So if anyone would like to provide public comment, we ask that you keep it to 2 minutes each. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue.
Good evening, Chair Doñate and members of the committee. Thank you for 2 more minutes of your time this evening. I'm Steve Messenger with the Nevada Primary Care Association. It's MESSINGER. I want to call this committee's attention to the critical funding that Nevada's community health centers stand to lose. These dollars come from a federal prescription drug discount program called 340B, and they amounted to an estimated $36 million of non-taxpayer funds in 2023. Through an unfortunate accident, this legislature did not introduce BDR 52-511 that would have protected this funding. Health centers face other serious funding concerns as Congress weighs how to save money in Medicaid, and these dollars are more important than ever as we are so uncertain in our federal standing. However, we are optimistic that this body will work to correct this mistake and find a place for this language. This committee has worked so hard to increase access to health care for all Nevadans, and particularly for underserved communities where our health centers may be the only source of access. It would be a tragedy to allow this resource, again, non-taxpayer funds, to go away or to have to replace these dollars with state funds. Thank you so much for your consideration. Have a wonderful evening.
There are no more callers at this time.
Thank you. Thank you so much. That concludes our public comment and the order of items for today. Again, just for tomorrow's purposes, so we do have an agenda right now that is public, that's posted, that it's a call of the chair. We are going to attempt to update that agenda tomorrow morning with the list of bills that will be on work session, and then stay tuned as to what time we do the work session. It just depends on the order tomorrow because it is deadline day. So just be on the lookout sometime before around 8 to 10 a.m. as to what bills are going to be on work session for tomorrow. With that, thank you so much for joining us, and the meeting is now adjourned. Thank you.
Thank you.